Good afternoon. I'm going to call to order the meeting of the Metropolitan King County County Council for Tuesday, May 26, 2020. Welcome, everybody, and I would like to ask our clerk to please call the roll.
Thank you, Madam Chair. Councilmember Dembowski.
Here.
Councilmember Dunn.
Here.
Councilmember Cole-Wells.
Here.
Councilmember Lambert.
Here.
Councilmember McDermott.
Here.
Councilmember Upthegrove. Councilmember Von Reitbauer.
Here.
Councilmember Zahalai.
Here.
Madam Chair.
Here.
Madam Chair, you have 8 members and Councilmember Upthegrove is currently excused.
All right, thank you.
Mhm.
As usual, we do not have a flag present to do the flag salute, but it is an important part of our agenda when we meet together. And so I like to take this opportunity to just say a few words. And since we just passed Memorial Day yesterday, it seems appropriate to take this moment to honor the men and women who have served our country in the military, and especially those who gave their lives to protect our freedoms. I know many people honored this tradition in many different ways yesterday, not the ways we're used to doing it since we weren't able to have the ceremonies that we're accustomed to. But I found it really fascinating to read an article that I found yesterday that suggested the first official Memorial Day ceremony was actually held just after the Civil War in the 1800s in a community that was largely or entirely African American, because they wanted to say thank you to the soldiers who had helped to secure their freedom. So I thought that was an interesting historical note and a way to honor this important day. For the record, I want to welcome Councilmember Upthegrove. Thank you. We now have a full complement of members. Glad to see you. And we'll move on in our agenda.
Madam Chair.
Yes, Councilmember Von Reitbauer.
Point of personal privilege.
Go ahead.
As I believe the senior member of the council, I had the privilege of joining the council back in the 1990s. And my first job was chair of the budget committee for 3 years. And in that capacity, I had the privilege of working with some incredible staff that I inherited. And we lost one of them over this weekend. Michael Huddleston passed away on Saturday. He died of COVID-19. He had been ill for about a month. And I would hope that we can have a moment of reflection for Michael, who many of us had the privilege of working with. And I had the privilege of learning a lot from him as a new member of the King County Council. So with your permission, I hope we can have a moment of silence and appreciation for Michael.
Yeah, thank you for bringing that up. I think many of us worked with Michael. He worked for the county for almost 30 years. So let's just take a moment now and just give a moment of silence for our colleague who's not with us. Well, thank you for doing that. And thank you for bringing that up, Councilmember Von Reitbauer. He was a fixture on the 12th floor, and he will be missed. All right, moving on. Vice Chair McDermott, would you put the meeting minutes before us?
So moved, Madam Chair.
Motion has been made to approve the minutes of May 12th. All those in favor, please signify by saying aye.
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 Any opposed? The minutes are approved. Are there any additions to the council agenda today, Madam Clerk?
I have none, Madam Chair.
All right. Just a brief word of introduction here. In light of the public health emergency, the governor has issued an emergency order suspending the section of the Open Public Meetings Act that requires we have a physical space for the public to watch our meetings. This order has been extended by leadership of the Senate and the State House of Representatives. When meeting remotely, we're limited in the matters we can take up to those that are necessary and routine or necessary to respond to the COVID-19 outbreak and the current public health emergency. The matters on our agenda today for briefing or action have been determined to meet these criteria. I want to remind members that you received an email shortly before the beginning of the meeting entitled the Green Folder. It's the virtual version of the Green Folder we receive on the dais when we're in the chambers. And that holds the additional meeting materials you'll need for today. Our first item is a briefing where We're really privileged to have Patty Hayes, the Director of Public Health, Seattle King County, and I see Deputy County Executive Rachel Smith to give us an update on the county's public health response to coronavirus. So I want to welcome you both, and I'll call on Patty, but I want to remind everybody that they do have to leave right at 1:30, so let's get to it. Welcome, Patty.
Sorry about that. Thank you so much. Trouble getting my unmute. I really appreciate the opportunity to give you this update on the King County plan for COVID-19. Rachel and I have a PowerPoint that we're going to go through. Will be the crisp, so I'll turn it over to her for that. Hopefully you have that up in front of you. So Rachel.
Thanks, Patty. And yeah, as Patty said, we are going to tag team here. First of all, I want to say that it is really nice to see everybody and to hear your voices today. Madam Chair, thank you. We are really glad to be here today to kind of give a big overview, if you will, on all the work that we've been doing. I think you all know that it's been a dead sprint essentially since the end of February. And I know we've been regularly updating you on all the activities of public health, getting your feedback. You've been engaged with Dwight Dively on all of the budget material. And this is sort of our attempt to kind of encapsulate everything that we have been doing and kind of put that all in one package. And is the PowerPoint up now? I can't see it, but
we don't have the ability to share the screen on these Zoom meetings, but they have it in their green folder that they received about 15 minutes ago.
Outstanding. So I'll speak first to the slide that says King County's role. And as I said, if we sort of look at everything that we've been doing from February and fast forward to here, we've organized ourselves into kind of 8 key areas. One, providing transparent data to inform decisions. Patty's going to talk more about that in a moment. Testing, contact tracing, and that partnership with the state and the King County pilot. The needed materials and supplies for us to begin thinking about reopening safely. The guidance and materials to employers and community, a space that public health knows well and has been very engaged in. Standing up the needed facilities, so isolation, quarantine, ACRC, prevention and response in congregate settings, and then potential modifications to King County government. So if you go to the next slide, I will flag sort of, I think every single conversation that we have around this really does have to start with the partnership and the coordination that we have had with the state, both Patty and her colleagues with Department of Health and the governor's office. We've worked very closely with the county executives of Snohomish and Pierce County, with a number of the mayors of the large cities and with the Sound Cities Association. And I think it is fair to say that with very few exceptions, these leaders have been exceptional players and partners. And I really have been impressed with how authentically everybody has kind of put aside differences to be able to work together. And I think the other reason I wanted to highlight this here is because our work with the state really is it is complementary. So we in public health aren't putting forth different kinds of requirements and guidance that is in any way additional to, separate from, in conflict with the state. So everything that you see here as we talk about these partnerships and activities are partnerships with the state. If you want to go to the next slide, data, I'll turn it over to Patty.
Great. So as you all know, we have been working to make data dashboards available and data tools. It's one of the most important things in our response is to have good data. Dr. Duchin and his team are looking at a massive amount of information that they collect, but we want to put it together into some dashboards for the public so that they can look at what's happening and how we are doing here as a county. And this is going to be a continual evolution. You'll see right now on this slide, we have a daily summary dashboard, a long-term care facility dashboard. We did work to have and show the disparities in race and ethnicity and then turn that into a dashboard and continuing to do work on that. And then what's called syndrome surveillance. And that's a number of things that we watch that have to do with how we sort of do surveillance and look at the flow of things over another measures, such as the number of people that have COVID-like symptoms and how many pneumonia cases are happening in and around the county. We're adding to that more information related to disparities. We're going to be putting up additional information on death data. There's been a lot of interest in that, on how we're tracking that and what are we missing any cases, which we don't believe currently. That's a big gap here in Washington State, but it's been in the national news. And perhaps most importantly, a data dashboard that's going to be publicly facing about the metrics we're watching, because the community really needs to know where we stand vis-a-vis the key elements that are related to the dials the governor has on his dashboard. If you go to the next slide now, this is a little bit more about how the inequities play out. And we have been watching this, and as I talk with jurisdictions around the country, depending upon where their first outbreak showed up, their data is basically all beginning to show the same things that ours are. These disparities, particularly with white, Hispanic, and Native Hawaiian, and that it relates to the social determinants of health. So because of the pandemic, but it's for multiple reasons. Folks have more underlying health conditions. Folks who have employment patterns that put them in essential worker categories, and where their economic conditions are such that they risk themselves by going to work because of their poverty status. So many people of color and low-income families live in multi-generational homes in which employment is an essential piece, obviously. So what we're doing is doing more work with our communities and our communities of color organizations from there through our pandemic advisory committee, so that we can make sure that our messaging and our assistance in public health, so that these households, when a case happens and there's multiple families living in one household, they can be given information and be safe and stay as healthy as we can. This is an interesting chart that you'll see us talk more about. This gives a cadence over time on health insurance coverage. You'll see the improvement we made after the launch of national healthcare reform, and also the extension when children could stay, or young adults could stay on their parents' insurance till 26. And then you'll see very abruptly an increase, and that's been happening very abruptly because of the number of people that have lost their insurance and lost their jobs, so they can't afford insurance. So that will be a trend we're watching.
Patty,
The key
can I ask a question about this slide?
Yeah.
The y-axis has, or maybe it's got 0% to 20%. So this is clearly not all coverage. What does that represent?
So over time, we've tracked the percent of folks who are uninsured in the county, and we track this both for adults, families, and for children. So in past prior, back to 2009, you can see we had trending around a 16% uninsurance rate.
Oh, it's
and then when the Affordable Care Act was launched, that dropped dramatically and continued with some improvements that were made. And this is based upon Medicaid data, the Health Insurance Exchange.
Yeah, I got it. I can pause you there because I didn't understand that this was showing the uninsured.
Yeah, we should had that labeled, so
Okay, go ahead.
apologies for that.
No, please go ahead.
Great. Next slide gives you a graphic that we're developing and hope to launch very soon, which is going to be a key metric dashboard. This will be that public-facing piece that talks about what are the key targets we're looking at to meet in order to show that we're handling outbreak and that we can move between the phases the governor's identified. So we really look at it in totality, but you can see it's going to have red and green so that the public can see. And we're going to be messaging around the public's role in being successful in moving those dials. The next slide is about the testing process. We get a lot of questions about this. So first, let me say that most tests are provided through employers and private providers, as with other kinds of healthcare tests. So the COVID test, we work in partnership with many, many partners, Kaiser, UW Medicine, the state. We're really trying to find as many partners as possible. If you think outside COVID for a minute and think about a test for an illness, it makes intuitive sense that nearly all testing in King County is from the private healthcare industry. And we really need it to move that way because of insurance coverage, et cetera. So under normal circumstances, public health doesn't have a primary role in this, but we stepped into this space for this pandemic. So what we're trying to do is develop the system that we can use and normalize going forward. And so if you look at the next slide, this is how the testing process fits in specifically with a key part of public health work, which is case and contact investigation. So you have a specimen collected, could it be at your healthcare provider, could be in the hospital if someone went to the emergency room, it could be done by a community health center or one of the drive-up testing sites. It goes to the lab finalizes the result, it gets sent at that time to the state, which gets the result to Public Health Seattle County. If the result is positive, we begin our case and contact tracing, which then hopefully the provider, when they did the test, inform the person that if it came back positive, they'd be required to isolate and quarantine themselves and their contacts so that that's not new information. But we pick up that work in helping individuals and families be successful. So now the next slide, which is slide 10, the goal of it is that we notify the contacts of the exposure, facilitate their referrals. If additional testing is to be done by their family members and clinical care, we reinforce the quarantine recommendations and we work to help the individual or family be in compliance. So we're watching this as a whole system. And for those of you that have seen me talk about the work we've done in measles or other diseases, this is the same process that public health does for those. So the next slide, which is slide 11, we're doing a pilot right now to look at what is the ultimate contact tracing and case investigation for COVID, knowing there's a lot more cases and therefore we need a lot more infrastructure in this. How do we work with other partners in this? So in the beginning, we were thinking, and on average, we had 100 cases a day. We're below that right now. We were doing 20 to 30% of those cases in this pilot with our goal to ramp up and be able to do all the cases by July 1st. The state has been a key partner in this to help. We work very intensely with cases, in many cases from diverse racial and ethnic backgrounds with limited English. Really requires us to work with community partners. So that's one of the reasons why we want to bring that into King County. So the next slide, I know I'm busting this really fast for your time, is back to Rachel on face masks.
Great, thanks, Patty. So again, we're kind of walking through this progression where we've looked at the data, we understand how that's being used for informing decisions. We've talked about testing. We know that's another key element in being able, and all this sort of driving to the reopening safely. Obviously, the contact tracing, which Patty just talked about, which, my phrase is it sort of takes the place of extreme social distancing, which is what we have been doing. And next up is the supplies that are needed to open safely. And I think, there's obviously the face covering directive that King County Public Health, Dr. Duchin, had ordered. Also, we know that businesses are going to need a lot of these materials to be able to feel comfortable opening safely and for customers to feel comfortable going there. And not just businesses either, also community-based organizations and other places where there's going to be gathering, whether it's for commerce or for other social reasons. And I think, when we look at what that includes, it is everything from masks or other face coverings to hand sanitizers to thermometers and things like that. So what we've been really putting our thinking to of late is, and this is really kind of a more of an open space, and we're going to want to have more of a conversation with all of you, is we want to explore how to use the buying power of government and large business to sort of draw these resources into our community. And we think, for example, that using our bulk purchasing power at King County, that we could potentially secure supplies for 50 to 75% off. We also know that there's a lot of either sort of business-based kind of chamber organizations or community-based organizations that we have already used to be pushing cloth masks and things like that into community. I know a number of you have also been doing that in your districts. So we really want to explore some ways of how do we draw this material into this community? How do we work with all of you to push it back out? Once we have it, and how do we do it in a way that helps really keep the prices down? And we're going to be working with the business community on that as well. And we hope to have some kind of frame of a proposal to discuss in the next week or two on that. Next slide, staying with the theme on safely reopening, in addition to the actual material that folks need, of course, public health has a trove of guidance and other materials to help people understand what they need to do to open safely. There's a couple of things I want to highlight here. One, the state's issuance of guidance through Department of Health and the governor's office by sector is what is going to allow a sector to open in each phase. And I think folks generally have a sense of that, but essentially the governor has identified these multiple phases, and within each of those, once a sector has guidance that has been released by the state and they are in said phase, they then can move forward. Public health is not duplicating that effort. Or public health is working closely with the governor's office and DOH on that guidance. That being said, the sort of translating that into your everyday business, trying to wade through public health guidance, CDC guidance, DOH guidance, and to be able to make it applicable and clear is a real challenge. And so we are looking at how do we make that existing public health guidance really accessible. Certainly, we've been working closely with a lot of the large businesses in the business community through Challenge Seattle. They have developed some of their own material, and also businesses that have a global presence have obviously gone through this in other countries and communities. So how do we bring their best practices and help infuse those into our community? We have a pandemic advisory group, which I think you're familiar with, that's also providing expertise and guidance. We have had a longstanding education campaign. I am sure all of you have seen Dr. Duchin's face or some of our sports stars telling you to stay 6 feet apart. We really want to talk about how we pivot that now as we move into new phases. How do we pivot that education campaign, but really keep those messages strongly going into community? We're talking about webinars and online materials. And then technical assistance. How can we actually be able to, obviously we can't review every single plan for every single business in King County, but how do we provide some level of technical assistance? And as we move this forward, we really want it to be in partnership with cities as well. So we're going to want to talk with Sound Cities. City of Seattle, for example, also has the Office of Economic Development. So how do we meld all those things together so that the resources are flowing to everybody, and that we're not duplicating efforts, but instead bringing together all of our resources so that we can get more bang for our buck on that. And so again, we will just continue to use all the tools in our toolbox, and I'm going to be personally working closely on this. Chair Balducci and I have had a number of conversations in this space, and also really bringing our ESJ lens through Matthias and some of the folks in Patty's team. So I know that Dr. Duchin, if he was here, would say that some of his biggest concerns are in employer-like settings going forward, and in particular in settings where folks may not have the level of resource and access to information. So this is an area where we will take up the mantle on his behalf and make sure that we're getting that information out. If you want to go to the next slide, we're going to pivot, and then we'll just wrap up here quickly on sort of the congregate settings. And I think the main things I want to say here is that, again, public health and King County have had to take an outsized role in working with folks in congregate settings, and that's primarily homelessness, detention facilities, and long-term care facilities. And the main thing I want to focus on here is just as a reminder, as we move into phases, as we relax social distancing, the folks that are in these settings are more vulnerable, not less vulnerable. So as we continue to quote unquote get back to a new normal, and there is more sort of disease spread in the community, we really have to keep our eye here. So I think in some ways folks feel like the really urgent response is where this was needed, but we need to continue to keep this infrastructure in place as we begin to relax social distancing. If you go to the next slide, you'll see isolation, quarantine, the shelter de-intensification. I think you are all very familiar with that, so I won't linger too long. And then the next slide similarly really lists everything that we have done to date. And I think the key thing I just want to say here is to really look at how much we have done in terms of making these spaces available. And we're really using every tool at our disposal, whether it's the de-intensification through motels, setting up the I&Q facilities, and assessment and recovery. And just again, we will need to keep those, especially some of the I&Q and assessment recovery facilities, operational as we move into the phases and relax some of the social distancing. So with that, I will turn it back to Patty to talk about long-term care and detention, and we will wrap up.
And if I can add one other thing, a really good sign that we've been really successful in the public health approach during COVID-19 with the homeless is that we've only had one case in the last 3 days with a person who's experiencing homelessness. So the different strategies and partnerships has been workable. That doesn't mean that, as Rachel said, it's not going to become clearly more at risk as we open it, but I'm very happy to see that number. For long-term care facilities, you all know, and we've talked already, that this is a huge and will continue to be a hot spot. We have big gaps. There's been national news on the problem with infection control in these facilities that need to be worked on from national level to state level. And we're working with these facilities here. So that will continue. The next slide, which is slide 18, long-term care facilities. We continue to do infection control and prevention. We're doing initial testing across the skilled nursing facility, a pilot with adult family homes to really consider that, and then working with particularly the memory cares with assisted living. And then what we call cohorting, or if there is a case in a facility, working with that facility so that those folks can successfully isolate and quarantine. And in the case of adult family homes, we've had a number that have had to close in a couple of your districts because of the level of infection and the infection in staff. then the detention facility with jail health services and our advice to the children and youth facility. We are working on reducing inmate capacity. Has been a wonderful thing that's happened, so that we can then do the risk analysis of how we take care of people who are in these facilities. So that, compared to the rest of the country, has been working pretty well. Again, the longer we go into this, we're still at risk, but we've been, to date, a really good job of getting ready and dealing with cases as they pop up, mainly in the staff. Back to you, Rachel.
Thanks, Patty. And so we'll just wrap up by saying, obviously, while every other enterprise here in King County, large or small, is contemplating what their new normal looks like, we are doing the same. It's interesting, with our public health role, we're constantly telling others what to do, from public health guidance perspective. But I am always telling business folks and community-based organizations, we have to then interpret that as well for our own operations in King County. And so, we are actually rethinking on customer-facing operations. Are there things that we had done during the shutdown that we may want to continue to move forward? That is also true in thinking about our own workforce ramp up in terms of telecommuting, those PPE and supplies that I talked about. We're going to need that here for our own employees and folks in King County as well. And then also, the employee engagement and support for people to be able to do jobs that they have never had to do in a setting like we are right now. Obviously, Dwight is on the line. You have all heard from him a lot and engaged on the budget. But, in some ways, we're in a good spot with our reserves and our financial policies, and federal resources. But obviously, this is going to be a real challenge. And it's not just for us. It's going to be a challenge across all of our governmental partners. And so that just adds to the challenge that we have to manage. And then I think, finally, it's, do we want to really rethink transforming certain parts of key operations? I mean, riding transit is going to be different in the future. So what does that really look like? And how do we want to engage our community in a conversation around that? So thank you for letting us sort of get through a lot of material, but we thought it was a good roll up of kind of everything that's kind of on the daily work plan that we're still going through as we relate to the COVID response. And Patty and I would be happy to answer any questions. Thank you all for your time.
Thank you, both Rachel and Patty. And so I know that when we planned this, we planned to try to get you done by 1:30, and it's a little bit over. I appreciate you staying. We can do this one of two ways. We can just go into Q&A, but that means you're here with us for a little while longer. Or if you have to go, you can be excused, and I can collect questions here that we can then follow up on and get responses later. I want to ask you which works for you.
I think we would take the latter, as much as we would love to stay, and I really would. I miss you all, so it's really nice to see you. But we have some conversations with the governor's office today that we to run to that hopefully will help inform, I think, what I know we are all really eagerly awaiting to hear, which is kind of what's the next step here as we're peering down the lane at phase 2. So really eager to get some of those conversations going and to come back and share what we're hearing there and get your feedback as well.
Well, I know that we have many members and constituents who are eager to get safely into phase 2. So why don't we let you two go and do that? But members, I am going to pause here and stay on this item, even though our guests are having to leave. This is a fond goodbye for now. But I'll call on anybody who wants to state a question on the record and then commit that we will follow up and get answers. And we can put those answers on the record as well, if that's the member's wish. So who has questions and would like to go first?
I don't need to go first, but I have questions.
Well, you hit unmute first, so you win. Go ahead.
I win or I no. Thank you. Well, I have a couple of questions. First of all, thank you for being here and giving us this information. I do think that the governor needs to hear that there are very small businesses that are in crisis, and these are businesses with less than 10 employees who from the very beginning felt that they could keep the 6-foot distance and safety. But I did meet with one of my chambers last night, and for a long time actually. And there are businesses that are considering in the next 2 or 3 or 4 weeks whether they will have to close permanently. And we cannot let that happen. So the very small businesses need to be rescued immediately. I also requested help in getting an N95 masks and got back a very interesting email. And so at some point, I'd like to talk about not only the tone of the email, but some of the other things that were in the email. I did forward it to the people who had asked me to get them the information with my own little note saying, don't shoot the messenger. I don't like this email either. And unfortunately, that's what I had to send. I was appreciative of the idea they're talking to the large cities, but they also need to be talking to the small cities. And the small cities are feeling very much left out. That even though they have a variety of issues that are different than small cities, they are being put behind the large cities and feel that they should be able to come out quicker and help get the economy going. And looking at some of the data, some of the raw data had like 68 people in a cohort, and then another in the same database had 2,000. And I realized that they were basing it on per 100,000 people. But when you're basing it on 100,000 people and you have 68 in the cohort, it really skews the look at the data. And so I'm very concerned about the data saying things that may or may not be accurate because of the disparity in the size of the cohorts of the data. And my last question is, let's see, I think it would be very helpful in the data if they could publish what the rate of transmission is. I know we were trying to get below 1.1% for every one person that was infected, they were infecting one person. So we were never going to bend the curve. And then I heard we got down to like I heard 0.68 at one point. And I've been trying to look at the dashboard every night at 4 o'clock to see if I can figure that out. And it would be really helpful if that, since that is one of the criteria, if it were actually more clearly stated. And a comment that I would like to make is, in talking to people in the medical field, they are seeing that a lot of their employees are dealing with PTSD and extreme stress. And now with the furloughs for the hospitals, that is causing even more stress. So it is unfortunate that the hospitals were not open earlier when they first requested it. But I think that is something we need to be looking at as a public policy, especially in areas where we have some input over at least one hospital, that I am concerned about laying some of these people off at a time when we need to maybe be rotating because of what the employees have been through. That is my list, Madam Chair. Thank you.
Thank you. I collected all of those and I will definitely make sure that we get them submitted to the executive and publish any responses.
Thank you, ma'am.
Do any other members have questions to put on the record at this point? Or shall we continue? I'm not seeing anybody rushing for the unmute button, so I am going to continue. By the way, I have some questions as well. I'm not going to belabor the meeting at the moment with them, but I do have some questions about the data presented, and so I will put those in the list and share them with you all when I get answers as well. Okay, moving on. This brings us to item 7 on our agenda, which is general public comment. And what we're going to do for the purposes of the public following along is first we're going to tee up the items that are on the agenda for public comment, and then we will move into public comment. So the first thing I'm going to do is call on Vice Chair McDermott to move to relieve the Mobility and Environment Committee in order to take action on item 9.
So moved, Madam Chair.
All right, that is before us. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries. Vice Chair McDermott, would you move to suspend the rules to take action on items 13 through 15 without referral to committee?
So moved.
All right, those items are before us to suspend the rules. All those in favor, please signify by saying aye.
Aye.
Any opposed? The motion carries. So for today's meeting, we're going to be combining public comment and the public hearing on ordinances which are listed for action. Under the council's rules, we offer the public the opportunity to make general public comments on the fourth Tuesday of each month. This public comment period is limited to 30 minutes generally, and each person will have 2 minutes to speak. General comment is limited to matters relating to county government, may not be used for the purpose of assisting a campaign for election of any person to any office, or for the promotion of or opposition to any ballot proposition, and may not address any ordinance that is on the Daly's Council agenda for public hearing. But since we're combining them, that doesn't really matter, right? You can speak about an ordinance that's on for hearing. And we do ask that your comments not include obscene speech. If a speaker fails to abide by these limitations, I will rule them out of order and require them to exit the virtual meeting. Before we hear from the public, as we go into testimony and comment, I want to just make sure that everyone who has called in understands how we're going to manage the process. As you called into this meeting, everyone was automatically muted. We can still see your name or the last 3 digits of your phone number. So our clerks will identify people through the list by name or number, and then they will unmute your line. When your line is unmuted, we're going to ask that you wait to be acknowledged, state your name, and then let's make sure we hear you, and then you can begin your comment and the timer will start going at that point. Some folks sometimes are muted on their end, like if you have a phone with a handset that may be muted, that's not muted by our Zoom meeting, please make sure you're unmuted when it comes time for you to speak. At this point, I want to ask the clerk about how many people do you think we have on for comment or for public comment or testimony?
We have about 9 people on for comment.
Okay, so we'll stick with the usual 2-minute limit. I was concerned we were going to have a lot of people today, but it seems like we've got a number that will allow us to use the full 2 minutes. So once you've been acknowledged and we know we can hear you, you will have 2 minutes to speak, and a timer will be used. You may hear the timer go off when you've reached 2 minutes. At that point, please finish your thought if you're still speaking, but I ask that you do wrap up your comments briefly to allow the next person to speak. If anyone goes very much past 2 minutes, we'll end up having to mute you or interrupt you, and I hate that. It's rude. So we ask that people please monitor their time. If you are listening on the TV or streaming at the same time that you're on the phone, please turn that function off or else we'll hear feedback and echoing on the line. So once you have finished your testimony, just to make it easier for us to manage the call, we ask that people then hang up and follow the remainder of the meeting on King County TV, channel 22, or stream it online at our website, which is www.kingcounty.gov/council, and then just click on the Watch Us Live button. All right, so with that ground rules all set, I'm going to now ask the clerk to read the items into the record that are the subject of the public hearing today. Please go ahead, Madam Clerk.
Thank you, Madam Chair. Item 8 is proposed substitute ordinance number 2020-0186 relating to rates and charges for sewage treatment and disposal. Item 9 is proposed ordinance number 2020-0173 authorizing the King County Executive to execute an interlocal agreement with the Cedar River Water and Sewer District to complete a coordinated project for the replacement of a culvert and relocation of water main and sanitary sewer lines on 162nd Avenue Southeast at Southeast 166th Court. Item 10 is proposed ordinance number 2020-0134, approving and adopting the collective bargaining agreement negotiated by and between King County and King County Juvenile Detention Guild, representing employees in the Department of Adult and Juvenile Detention, Juvenile Division, and establishing the effective date of the agreement. And item 11 is proposed ordinance number 2020-0185, approving and adopting the collective bargaining agreement negotiated by and between King County and International Brotherhood of Electrical Workers, Local 77 Metro Transit Department, representing employees in the Metro Transit Department and establishing the effective date of the agreement.
All right, thank you. So those are the items before us for public testimony. We also have general public comment today. So if you've called on some other items that are not on that list, you may speak to those as well. And with that, I'm going to ask the clerk to begin unmuting lines and calling on people to give public comment or testimony now.
Thank you, Madam Chair. The first person on the list is Nancy Conley, and you are unmuted, maybe.
Hello, can you hear me?
Yes, I can.
Hello, shall I speak then?
Please go ahead and give your name and spelling for the record.
My name is Dr. Nancy Connolly, Nancy, last name Connolly.
Please go ahead.
Thank you for this opportunity to speak. Thank you to King County, the City of Renton, and the owner of the Red Lion Hotel for the opportunity we have had to pilot a new way of tackling the homeless problem in our region. I am a primary care doctor with over 20 years of experience working with people from all walks of life. I've been working with the homeless population exclusively for the last 18 months. It has been a remarkable experience for me to witness the improvement in the health of these people moved from the impossibility of safety and security in the main downtown shelter to the place of refuge here in Renton. Many of DESC's clients have profound mental illness. Most have experienced significant emotional trauma, often at young ages. To try to recover and rebuild a life in an environment where there's not basic safety or privacy, impossible to provide in a large congregate setting, is incredibly challenging. The most we could do is bear survival without hope for improvement, although DESC staff regularly perform Herculean accomplishments in the setting because they must. With basic safety, adequate sleep, privacy, and hygiene assured, we have started to address deeper problems and can build on the healing to help people achieve next steps such as permanent housing, jobs, stable mental health care. I know that hotels such as the Red Lion, designed to serve travelers, are not ideal long-term solutions for many reasons. But right now, we need more time in the hotel to determine what comes next. As a community, from a place of shared compassion, we need time to thoughtfully plan next steps. Please extend the lease on the Red Lion Hotel while together we come up with genuine solutions to our very real problem of homelessness. Thank you again so much.
Thank you. The next person on the list is Amy Tower, and you are unmuted.
Hello, can you hear me?
I can. Please go ahead.
Okay, wonderful. Thank you so much. My name is Amy Tower, A-M-Y, and then Tower like a building, T-O-W-E-R. And I am an education counselor and organizer with the Tenants Union of Washington. And I have some comments today about the first reading of the proposed ordinance number 2020-0191 about eviction protections, tenant protections related to the coronavirus pandemic. I want to congratulate and really thank the council and the staff for their efforts. I think this is a really great step. Of course, as the state eviction moratorium is coming to a close, hopefully it will be extended, but I know that there's going to need to be a lot of action on local levels to help protect tenants and keep them in their homes. Like even the previous speaker is saying, housing is such a key part of healthcare. So thank you so much for putting this forward. A couple of things that I wanted to offer. One is that it would be great if the proposed ordinance could include manufactured housing tenants, so or folks who own their home that might be a manufactured house or a mobile home and rent the land beneath it. If they could extend the protections to those folks as well, that would be really key, as well as including good cause protections in the ordinance. So right now, Seattle, Burien, and Federal Way are the only cities in Washington that have good cause protections, which requires landlords to give a legitimate reason, a business reason for terminating a tenancy. In all other areas, including lots of all of unincorporated King County, tenants can receive a 20-day no cause notice, so the landlord doesn't have to say why they're terminating their month-to-month lease. And so this is something that we're anticipating will be a huge wave, again, of these kind of no-cause terminations. It's a protection that definitely we need countywide. So if they can include that in the bill as well, that would be really fantastic. And thank you so much.
Thank you.
Next person on the list is Cynthia Ramos, and you are unmuted. Please go ahead.
Hi, this is Cynthia Ramos, RAMOS, and I am the organizing coordinator at Una Latina de Vashon. We are an organization that has been organizing for over a decade, and most recently has established a center where youth and families learn to be mental resilient and create prosperous economic opportunities. We, like our partners, are an organization that is run by and for Latinos. And since day one of COVID, we have been relying on community ideas to help us survive this crisis. And despite the significant efforts, most are barely surviving and are scared. Even when help arrives, it is complicated and not hard, and it is too hard to navigate. I want to tell you that these applications for rent assistance feel like to a Latino family, and who does not know the language or the systems that can mean them losing their home. For example, the United Way application that was out recently, it asked for information that felt too private for families to share and made them feel vulnerable and their documentation status. Families are hesitant to share such information because it is too personal, and it is to organizations that they do not know nor trust. Families were required to share rental agreements, pay stubs, letters from employers, which is not easy to attain, nor is it something that they have. And if they need to ask, it is not easy to ask in such a quick turnaround. We have been working closely with churches offering assistance, and we have been that work for those both giving and receiving the funds. As you proceed with your discussions of CARES funding to support the most vulnerable, please make sure that the processes work for the most scared, and that you are supporting frontline organizers that best understand the concerns of immigrant families. Thank you.
Thank you. Next person on the list is Julissa Sanchez, and you are unmuted. Please go ahead.
Hi, good afternoon. My name is Julissa, Julissa, Sanchez, Sanchez, and I am the South King County organizer with the Tenants Union. And I'm here to speak on the proposed ordinance 2020-0191. And I wanted to make reference to the Seattle bills 119788 and 119784, as they are good foundations and good examples on the protections for tenants who are suffering the effects due to the COVID. And I do appreciate that you are working on this and setting this example for the rest of the state. I did want to also speak about the expanding and making sure that we include tenants from manufactured homes, and is that we really do put the just cause protection so that tenants are protected from any retaliation or any discrimination from the landlord based on whatever background they may come from, and not just get an eviction notice, or there is room for them not to get any kind of payment plan from the landlord. And yeah, just wanted to emphasize that, and just wanted to say thank you for all your work. And I hope that as you work into this, like the just cause is going to protect
many people of color, like we have said, and we know that this is affecting people of the Black community, of the Latinx community, of the undocumented community that are very often afraid to even seek for help and assistance and apply for funds because of many questions that may put them in a vulnerable position. So us passing or extending this ordinance to include just cause will protect them from any kind of retaliation or discrimination and homelessness. So thank you.
Thank you.
The next person on the list is Edmund Witter, and you are unmuted. Please go ahead.
Hi, thank you. My name is Edmund Witter, and I'm from the King County Bar Association. My name is spelled EDMUNDWITTER, and I'm speaking as to Ordinance 2020-0191 in support. This ordinance is an important step to ensuring we do not see a large wave of evictions in coming months, and I thank its sponsors for their leadership. But I do want to warn you that this may not actually be enough based on what we're seeing right now. Without a good cause protection, just as the previous speakers addressed, landlords can still coerce a tenant to leave, even with the mandates of this ordinance regarding rent, by simply terminating a month-to-month tenancy before a payment plan can be issued, or refusing to renew a lease for anyone who can't pay readily. This will reduce the ability of the tenant to negotiate a fair and reasonable payment plan. In addition, the incoming wave of evictions may be too large to be dealt with by deferring payments. Even in normal times, 57% of renters can't come up with $400 in the event of an emergency. And it's not likely renters are going to be better situated right now, given all the uncertainty with the pandemic and whether there will be jobs for them when they are able to return. But the need for intervention is significant based on the data we are seeing. Where evictions are currently occurring in other states, for example, in Arkansas, there's been a 217% increase in evictions in the last month. And that's despite the federal moratorium that impacts about half the rental market and the stimulus package from the CARES Act providing enhanced payment benefits or unemployment benefits and the $1,200 increase. Here in King County, our homelessness response system and our courts cannot handle a 217% increase in evictions, and that number is likely going to increase as the federal benefits subside in coming months. We simply don't have the money unless there's federal intervention, which is looking unlikely at the moment. 211 in King County has seen a 1,100% increase in requests for rental assistance in the last couple of months, and Homebase, the United Way program that we co-manage, had about $5 million allocated to help tenants. We ran through that in less than 48 hours. 77% of those applicants were from people of color, and a third of them from people who needed assistance in a language other than English. I stress that in addition to this ordinance, you need to look at what Oakland has done, what New York is doing to bar evictions for rent owed due to COVID, but still requiring the tenant to pay. It avoids overwhelming the courts, avoids overwhelming the homelessness response system, and it's going to keep people housed while ensuring tenants have large incentives to pay. I support this package, but I definitely think we need to also be looking at other measures as well. Thank you.
Thank you. The next person on the list is Noah Fay, and you are unmuted.
Hi, great. Can everyone hear me okay? Great,
yes.
Thank you. I'm here also with Mark Modica and Ross Williams, who signed up to do a public comment as well, and I want to make sure you know they're on this line. So if possible, I will defer the rest of my time, or I'll pass on to them when I'm done. My name is Noah Fay, spelled F as in Frank, A-Y for the last name. I'm here in support of the Red Line and the work that DESC is doing to house people in motels and hotels to avoid congregate shelter settings during the time of COVID. And I think I can be brief, but want to reiterate what Rachel said earlier. As we think about reopening in our society and moving towards phase 2, I want to do two things. Ensure, one, we are not losing sight of serving our most vulnerable people in our community and seeing them return to situations and settings where they're at greatest risk of contracting COVID, but also ensuring we're doing our part to keep the links in our public health response strong. I think we've been successful, as Patty Hayes referenced, in our homelessness response, in part because we've been a unified front. But if we no longer have options for people other than congregate shelters where people can't maintain social distancing, we run the risk of having an uptick in cases, not just amongst the homelessness community, but public health writ large. So I am here to advocate in strong favor of continued support of the Red Line Hotel and other hotel options as a way of avoiding people living in congregate settings.
Angel, why don't we just, if there are two other people there, why don't we just allow them to continue and do 3 people, 2 minutes apiece?
Okay, he's still unmuted.
Great. Want to come on in?
Good afternoon. My name is Mark Modica. Can everybody hear me okay?
Yes.
I'm here in support of the Red Lion occupancy with DESC. And there's a lot of positive things that have happened for me since I've been here. I'm a little bit emotional because this was a platform and a springboard for my successful transition to a physical address, which is in progress as I'm staying here. In regard to the corona or COVID-19, this was ideal for me to have my personal space, be able to touch base and coordinate with the caregivers or case managers and staff here. It allowed me to work on some of my soft skill sets as well, and an opportunity to work on future employment that is promising. I grew up in the Seattle area. I have some familiarity with Renton, and this community has actually been very welcoming. Some of the merchants, storefronts, and the economic impact for those of us that do have some limited income, but not enough income to support our own housing. I'm in support that this be extended, the contract, because this is a positive thing for a lot of us. And I don't think any of us has a picture of what homelessness would be like. I'd ask that everybody close their eyes and just think, is there a picture of somebody, how they would look being homeless? And I don't think anybody has a concrete or specific picture. I never thought I'd be in this position. However, I'm grateful that there is an organization such as DESC and that they were able to facilitate this property to house us. I'd like to just pass this forward to people to realize that there's a humanitarian part of us and all of us that should be aware that this could happen to anybody. Thank you.
Thank you.
Hello, everybody. Council, good evening. My name is Ross Williams, spelled ROSSWILLIAMS. I'm ex-military. Thank you for the opportunity to at least express our feelings and from DESC to the city of Renton. A lot of people in this area is wondering how are we maintaining, how we're doing it. The real answer is I don't know. All I know is that we do have basic understanding of what it does mean to be human, and trying to do as much as we can in the city of Renton as far as to comply with all the orders. With this not being in place, I don't know where I'm gonna go next. Like I said, I'm an ex-military vet. I've been in since 91, got out in pretty much 2000, and it's been a trial. I know the whole world has taken a step back because of the COVID-19, and I just hope that you understand, whether I'm your brother, your sister, or any of your families, nobody wants to go through this, and I would really consider that y'all give us an opportunity to keep on going and flourishing forward. Thank you.
Thank you,
Thank
Mr.
you. The next person on the list is Ryan Lufkin, and you are unmuted.
Hello, my name is Ryan Lufkin. It's spelled Lufkin. I'm simply here on behalf of the Juvenile Guild, who has a contract before you to move forward to ratification, and here to support that. That's really all I have to say. Thank you very much.
Your brevity will weigh in your favor. Thank you.
The next person on the list is Stephen Kovac, and you are unmuted. Stephen Kovac.
It does still show muted over on this end, Angel.
Mm,
Can you hear me?
We can now. Excellent.
Oh, good. So Steve Kovac with the International Brotherhood of Electrical Workers, Local 77, and I'm here to speak on behalf of Ordinance 2020-0185 and encourage the council to pass the contract that was negotiated in good faith with King County. It took a long time to get a contract and get it approved by the membership. We finally did it. I think it will help the county keep these hard to find electrical workers. You've had a lot of unsuccessful job openings trying to find people to do this work. I think this will keep what you have and hopefully get some others to look at the county as a place to work. I also want to thank Sasha Alessa from Labor Relations. It's nice to have a management partner who is open and honest. And I think Sasha does a great job and I appreciate working with them. I just ask you to support this ordinance. Thank you.
Thank you. The last person on the list is Allison Eisinger. And if you'll give me a second. It looks like she's gone, Madam Chair.
No, she's right there. I can see it.
Sugar?
Here on the video.
Oh, there you are.
Thank you so much. Thank you very much, council members. I appreciate the technical support at the last minute. For the record, my name is Allison Eisinger, ALISONEISINGER, and I am the director of the Seattle-King County Coalition on Homelessness. I want to thank you for the work that King County has done to move swiftly to respond to the COVID-19 outbreak and to help keep people experiencing homelessness, people who don't have homes to stay in or who can't shelter in place safely, safer. There's no question that fast work by King County staff, including public health, DCHS, facilities, together with incredible work by the frontline workers at homeless service and housing organizations that were already coping with a major crisis, has saved lives. And I think that given the very sobering way in which you opened your meeting by recognizing one of your colleagues who passed of COVID-19 over the weekend, I think we can all appreciate the power of that. As I participate in national conversations with my colleagues, I hope you know that in many ways what King County has done to protect homeless people is seen as a national model. We should build on the success that this community has demonstrated. We've followed public health guidance. We are led by science. We have slowed the spread of this deadly contagious disease. We are by no means out of the woods, but we are at a point where we have to figure out how to sustain the safety for several hundred people who are now sheltered in hotels in several King County jurisdictions, including Seattle, Bellevue, and Renton. What I'd like to share with you is that if we truly believe that we need a regional response to the regional crisis of homelessness, and my organization does believe that, there is no time like the present to prove the meaning of those words. We need to work together to figure out how to quickly afford the same life-saving and health-giving opportunity to many more people. Our fellow King County residents who experience homelessness are disproportionately people of color, disproportionately people who live with disabilities and with serious chronic health conditions. And we know that they are at the greatest risk from the coronavirus. I hope we challenge ourselves to ensure that we provide real and practical help, that we center racial equity, and that we respond to the call to perform social justice in acts and not just in words during this crisis. I hope you accept the report provided to you about the initial stay at the Red Lion, and I want to thank you again for the work that you are helping to lead. Thank you.
Thank you. Okay, having gone through the list, I'm going to ask that before we close the public hearing, Would the clerk please unmute everyone's line all at once? We're going to just make sure that there's no one left on the line who was wishing to provide public testimony or general comment and wasn't called on. So if you would please go ahead and unmute everyone momentarily. This will be a little loud, but we're going to do it. Are you able to unmute people? Oh, it looks like many people are unmuted, but not everybody. Angel, could you unmute everyone? Okay, it looks like most, except for council members who are probably muting themselves. So thank you for that, council. Is there anybody on the line who was waiting to provide public comment and who has not been called upon? All right, hearing nobody, we're going to go ahead and close the public hearing. Please go ahead and mute the lines again. Thank you very much, Angel, for leading us through that. Appreciate it. And thank you to everyone who braved the technology to appear in person. It's really nice when we can see you and hear you. It's better than email. And we appreciate your taking the time to give input into our meetings and our deliberations. All right, we'll move on in our agenda now. The next item is item 8, proposed substitute ordinance 2020-0186. I got that right? Yep. Regarding charges for sewage treatment and disposal. Vice Chair McDermott, would you move this item?
I move adoption of ordinance 2020-186.
Seems like we've got somebody who needs muting. Okay, thank you. We do have Mike Reed, who briefed us on this last week. Mike, do you want to make any introductory remarks or just wait to answer questions?
Sure, I can make a couple of remarks just in terms of context. So this is on page 19 of your packet. This is 2020-0186. This was passed out of the committee of the whole without recommendation on May 19. A full briefing was provided at that time, and you had a chance to engage with Budget Director Dively, with Wastewater Treatment Director Mark Isaacson, and Finance Director Heidi Popachak. Those staff, I believe, are available this afternoon as well. Just a reminder on timing. This is the subject of an interlocal agreement. That is, the rates are subject of an interlocal agreement with the regional partners, and that requires that the rates be in place by the end of June of each year. That requires council action either at this meeting or at the June 9 meeting. A number of questions did come out of the committee of the whole briefing. Responses were sent to you on Friday afternoon, and I could either walk through those at a high level or not. Madam Chair, with that, again, I'll take your instruction as to whether you would like me to walk through the responses to questions or your direction.
Mike, if you could do it in just maybe 2 to 3 minutes, could you give us a very high overview of what information has been gathered between last time and this time? I think it's good for the public to hear it as well.
Okay, I'll go as quickly as I can. So there are a series of attachments to the email, and again, you should have that available to you. If you don't have the email, I can send it to you. But the questions were asked on the impacts of not going forward with the 4.5% increase. The question was asked about which projects would be delayed or reduced. That is on the attached project list. I won't go through those in specific. The question was asked about what personnel impacts would be experienced, and for the operational budget, it would be about $6 million, which would translate to about 36 or up to as many as 36 FTEs. Other impacts that were identified, and this is more specific to the COVID-19 impacts, but that could fully deplete the 46.25 million rate stabilization reserve, and with that depletion, there would still potentially be a need to defer some of the urgent asset management projects. There were a number of scenarios that were asked for example, a 4.5 or the proposed 4.5% increase, a 2.25% increase, or a 0% increase. Those are enclosed in attachment B. I won't go through those given the time unless you request me to. There were also requests for a scenario of 0% increase for 2021, but 4.5% for 2022. Again, there is a scenario that's presented in the attachment B. You asked for a description of cost-cutting activities or undertakings that the agency has undertaken. The agency indicates that it has pushed out some of the asset management initiatives or priorities that it had identified as a result of the reduction from the 9.5% to the 4.5% increase. It indicates that it's putting a hold on travel and on training. It is limiting hiring to operational staff and maintenance staff. Other cost savings, it has noted that it has done a cash transfer to help pay off some of the high interest rate bonds, resulting in a $720,000 savings from those high interest rate bonds. And it will continue to seek low interest loans from the federal and state government sources. A question was asked about the status of reserves. I earlier indicated that with the COVID-19 economic impacts, there is a potential for depletion of those the state rate stabilization reserve, and again, that would result in potentially impacting the need to push back additional asset management projects. There was a question about how much the 4.5% increase generates, and it is about $19 million in 2021. There's a table, there was a request about what we've heard from partner agencies about potential impacts from the shutdown of business and industry and the rates that they would otherwise be paying. And the table under number 9 shows responses from 3 agencies, those being Bellevue, North Shore, and Alderwood. Bellevue indicates that comparing rates from April of 2019 to April of 2020, revenues from those periods, they are seeing an 18% decrease in the commercial multifamily category. North Shore is showing a 5% decrease from April of 2019 to April of 2020 in the commercial multifamily category. And Seattle, which represents 44% of the commercial multifamily RCEs, is showing a 13% decrease from April of 2019 to April of 2020. The next question, number 10, asks for identification of urgent asset management projects. And there's a list of, I believe, 12 projects that are listed below. Those are projects that had to be pushed out again, resulting from the reduction from the 9.5% increase that was initially identified to the transmitted 4.5% increase. So those were pushed out, I believe, 1 year. And then on question number 11, there was a request for information on what kind of impacts on small businesses would result in terms of their costs would result from this 4.5% increase. And there's a table that was provided, and that results from, I believe, one local agency, which was the only one that provides information in this form. One local agency showed increases, and I'll just refer to the auto repair category, which is the second listed category on your table. That has shown likely impacts of 46 cents per month, or $5.44 a year, and that's the low. And the high is the laundromat, which is the next listed item, which is $22 a month, or $264.38 a year. Again, Madam Chair, I will not go through, unless there's a request, I will not go through the attachments, which provide a more extensive project deferral list from the asset management category, and also provide a number of scenarios that I referred to earlier. Madam Chair.
Thank you. That was outstanding. It sounded stressful. You did a great job. Thank you.
Thank you.
At this point, I'm going to ask if the other people who are here from the executive branch have any input they would like to give up front before answering questions and before we move into discussion among the members. All right. See, Dwight is with us and Mark is with us, but they're not unmuting, so I'm going to assume.
Nothing
that-
for me.
Nothing from Dwight. Okay, Mark, anything you want to add?
Thank you for the opportunity and consideration of our rate. I appreciate that and look forward to the discussion.
All right, thank you very much. Let's move into questions and comments from members. I see Councilmember Cole-Wells.
Thank you, Madam Chair. Just I'd like to make a couple of remarks as the prime sponsor of this legislation, and just to remind members that we did send this to the council without recommendation, and gave the opportunity for individual members to work with us on any changes they might like. I understand that Councilmember Dembowski does have an amendment, and we will hear about that. We did adopt one amendment last week at the Committee of the Whole, and that was for a title. I'm sorry, it was a technical amendment. But I'd like to say that I know we're all aware that we've got an aging sewer system, and both West Point and South Plant are over 50 years old. And we learned from a briefing last week that a large part of our conveyance system is also 50 years old. The asset management inventory is the agency's list of priority projects to assure that the system continues to function well. And as this is a very large, complex system that helps us address concerns of public health, water quality, and resource reuse, we tend to focus on it when there's a problem, which we did have, as you know, at West Point a few years ago, major problem. But we don't want to have those again. And I believe from a lot of review that the proposed rate is a very appropriate one. We want to assure that we keep up the maintenance needs of our asset, and in doing so, we're more likely to avoid any future problems. So I am satisfied with this rate. I know that we do not want to bring undue difficulties for any of our ratepayers, especially given the COVID pandemic that we are experiencing. But it's a small amount of funds, and I believe if we don't go ahead with it, it's really going to cause more funding issues later on. So just a statement, Madam Chair.
Thank you, Councilmember Cole-Wells.
Lambert.
Councilmember Lambert.
Thank you, Madam Chair. I would like to say ditto to what the previous council member said and add a couple of things. We're talking about $2.04 a month. We're not talking about 86 or 68 or 500. We're talking about $2.04. Originally, this was a 9% increase because that's what they really thought we needed to do. And then they were told to go back and reprioritize. So in the reprioritizing, it came in at 4.5%. It is our responsibility to keep these pipes and services up in proper order. And I'd just like to read to you one little statement that is in our attachment A that I found particularly powerful. We talk about how important the environment is to us. And so one of the things here is that we will defer some of the maintenance until 2023. And it says further delay of the replacement or rehabilitation of pipelines and equipment that are currently in poor condition increase the risk of system failure, overflows, and or employee safety. The affected pipelines currently show extensive serious corrosion damage, and if they fail may potentially result in raw sewage overflows and damage to environmental sensitive or high traffic areas. Affected equipment typically have less than 2 years of expected service life remaining and or require spare parts that cannot be purchased. In many cases, failure of this equipment could result in overflows and our operating permit violations. If we have operating permit violations, we will be paying a whole lot more than 2.4 cents. And if you read attachment A, in several places, it talks about that it endangers our employees, that roofs could fall in. And in one place, it could shut down one of our plants. Reading attachment A is not for the faint of heart. You need smelling salts when you read it. So I think that the agency has done a very good job of reprioritizing. But I think that if we do not pass this, that we will be doing exactly the things that they say at the last part of attachment A. And I, for one, do not want to be having to go out and try to find replacement parts that don't exist, because that's more than a little difficult. I hope that we will support this even in these difficult times. Thank you, Madam Chair.
Thank you, Councilmember Lambert. Other members? I understand we have an amendment, and I believe the amendment would be in order at this time if it's going to be offered.
Move Amendment 1.
Amendment 1 is before us. Councilmember Dembowski.
Thank you, Madam Chair. I need to just say a few things here. Number one, this amendment would set the rate at a 0% increase, would not raise it in 2021, and then would return in 2022 to a return to the increase in rates. It's about a $19 million increase in revenue and on over $500 million. I have to tell you all that I find it implausible that the parade of horribles painted by the wastewater treatment division is likely to come to fruition if we don't spend $19 million more. For example, they have enumerated a number of projects that might be delayed. I don't understand why we wouldn't take a look at, for example, the $5 million a year in a program that I very much like, and I think it does great work, and that's our Waterworks program. They've not proposed to reduce any staff whatsoever. They're going to put a hold on travel. But I just need to say that the lack of rigor in this and the refusal to present real options just is frustrating. And we're not really in a position to do it unless you hold them to a tighter budget. The lack, with all due respect, of any acknowledgement in the presentation by the division last week of the unprecedented in the last century economic conditions facing this county at 15% unemployment heading to 20%, with hundreds of thousands of people out of work, businesses closed. But the focus of that presentation was all on themselves and the need for money. I found it offensive. And I don't like to be too critical publicly of our staff, but this is not the time for just regular thinking. The city of Seattle, in their response to our inquiry over there, says that they're concerned about folks being able to pay. They're seeing early challenges already with that. They oppose it. Our experts on the Municipal Wastewater Advisory Committee, the experts, have written a letter opposing it. The city of Kirkland opposes it. The city of Mercer Island opposes it. The SCA PIC opposes it. To say that all those folks are irresponsible, our partners, our professionals, doesn't resonate with me. So I wish that the wastewater treatment division could have been a little bit more forthcoming in presenting options. We have no analysis other than paying down about $700,000 of higher interest debt as to how the municipal interest rate market, which is down 75% in rates in the last 18 months. And this agency has driven in large part their budget by debt financing, why that doesn't inure to their benefit. No analysis whatsoever presented to this committee. So my amendment would hold for one more year at a 0 rate. And I think it's prudent. And I do think no matter what happens, that some additional scrutiny from an independent approach needs to be taken to this budget because the constant lack of real options and hard analysis when you're talking about this kind of money and the rates charged to our ratepayers, some of the highest, if not the highest in the country, deserves a little more attention.
Madam Chair.
Councilmember Cole-Wells, and then I wanted to ask a question myself. So you go ahead, Councilmember Cole-Wells.
Thank you. Well, what I was going to request is that we have somebody from Wastewater Treatment Division, whether it's Mark or perhaps Heidi or Dwight from the budget, respond to the good Councilmember Dembowski's.
I think that's wise, but first ask that somebody, maybe Mike, just please say slowly what the amendment does so that we have it in front of us and people understand what we're talking about. And then I will take you up on that very good suggestion.
Thank you, Madam Chair. So very briefly, the amendment, I should say the transmitted legislation would provide for a 4.5% increase for 2021, and the attached financial financial plan provides for a 0% increase for 2022. This would basically provide for a 0% increase for 2021, and the financial plan would provide for a 2022 increase of 4.5%. I should qualify that the council does need to adopt a revised rate each year, so you would have the opportunity next year to deal with the 2022 rate, but it basically moves it from 4.5% to 0 for 2021.
Thank you. Okay, so that amendment is before us, and I agree with the prime sponsor of the legislation, Councilmember Colwells, that this would be a good time for executive staff to share their views of what the impact of the amendment would be should we adopt it. Mr. Dively, Mr. Isaacson, would one of you like to answer? You seem to be unmuted, Dwight.
I was trying to start my video. There we go.
You are welcome. Good to see you.
Always feels a little better if we're actually looking at each other. So I think Mr. Reed did a good job of explaining what we see as the consequences of this. And I will just say, with respect to Councilmember Dembowski, we don't agree that we haven't provided alternatives and information. As staff noted, we started with a rate proposal that we thought was minimally necessary, that was more than double what is being proposed. We have already taken advantage of the ideas of lower interest rates. There is a very substantial refunding that is scheduled for this summer, that council action to demonstrate their support for the continued financial strength of the utility is essential to being able to access that market at the current bond ratings that we have. So we still continue to believe this is a reasonable request. As Councilmember Lambert noted, the impact is relatively minimal on everybody. It is, if you look at the recent history of rate increases for the wastewater treatment division, they have been less than the rate of inflation. Over a 4-year period or so, if the council were to adopt this, you would still be at or less than the rate of inflation. All of which seems to us that this is a very reasonable thing to continue our investment in water quality and environmental protection. There are very substantial future capital needs for this utility to simply maintain the infrastructure we have, let alone comply with the consent decree and other very critical items that are coming up in the next 10 years. The further behind we get on asset management, the harder it is going to be to catch up. So we felt this was a minimally necessary proposal. We think we are finding efficiencies throughout the organization, and the executive continues to advocate for this particular proposal. I think staff from wastewater are happy to answer specific questions if council members have them.
Thank you, Mr. Dively. I appreciate that. Okay, other members' questions or comments on the amendment that's before us?
Zahalai.
Councilmember Zahalai.
Thank you, Madam Chair. Could Dwight or any other members of executive staff just clarify a little bit more? What is the consequence of having a 0% rate increase this year? I don't think I heard that pretty clearly in Dwight's response. I did hear that all alternatives have been pursued and this is a conservative increase, and I heard those kinds of responses. I didn't hear what is the impact of having 0% this year. Thank you.
Mr. Dively, would you like to give your response to that?
Yeah, so let me summarize. I think Mr. Reed actually already spoke to this to some extent. So what we see as the downsides of not adopting the proposed rate increase are the following. First of all, it clearly reduces the amount of capital investment that we can make in the next biennium. And that is investment in critical asset management infrastructure. You have received a list of projects that potentially are affected by this. And so that is one major impact that we expect to have. It would require either reducing staff or holding vacancies on the capital side of the program. And the less we do with capital, then there is less projects out in the community that create design and construction jobs. And clearly those would be something in the hundreds of jobs that we would not have in the next 2 years. So that's one impact is to the capital program. Secondly, in the operating budget, the estimated impact is about $6 million. And as Mr. Reed noted, that's something like 30 positions that would either have to be laid off or held vacant over the course of the biennium. Third, there is a very clear effect on how the bond rating agencies and the financial community see the county in terms of our credit worthiness. Every one of the bond rating agency reports speaks to the willingness of the county council over the many years to raise rates when necessary to maintain the infrastructure that we have. And that is why the wastewater treatment division has basically the highest possible bond rating for revenue bonds. That would definitely be jeopardized if the bond rating community sees that the council is unwilling to raise rates to meet our asset management needs. And then finally, I think I would note that there is a very significant upcoming revenue loss for the division in 2021 that is similar to the impacts that Mr. Reed summarized for some of our component governments who we contract with to provide sewage disposal. So as commercial wastewater volumes decrease because of businesses shut down or operating at a smaller amount, there's a lag for our wastewater treatment division in when that impact occurs. That will mostly occur in 2021, and we can only guess at how much revenue loss that is going to be. That revenue loss, plus the lack of revenue from a rate increase, will significantly, we don't know exactly how much, but significantly reduce the reserves that the wastewater treatment division has. It will lower the debt service coverage ratio, which we can talk about if you want to get into the details of that, and probably bring it very close to the legal commitment we have made with our debt on how much revenue we have available for coverage of debt service. If we were to approach that or cross that limit, we would have extreme financial difficulty, and we would potentially be looking at things like having to do an emergency rate increase. So that is maybe the scariest thing from my perspective, is that financial impact. But I think for others, the potential impact on underinvesting in the capital program is probably a greater thing. So I will stop at that point. And again, either I or Mr. Isaacson are available for specific questions.
Councilmember Zahala, did that answer your question, or would you like to hear more from Mr. Reed?
Thank you, Madam Chair, and thank you, Dwight, as well. That did answer my question. When constituents call and ask about this, if I give a financial answer that talks about capital impact, asset management, bond ratings, that's not going to answer people's questions as clearly as they might like. Could someone speak to it as if I were a person who is paying for this rate increase, and the rate increase is 0% for this year? Even in the long term, if you want to speak to that, what does that look like on the ground for pipes, for service? Could somebody speak to it in that kind of language rather than from a business and financial aspect?
Let me make an attempt here. Last Friday, after we asked these questions at our committee of the whole meeting, Mr. Reed sent a couple of emails with some really detailed attachments that he rightly, because of the instructions I gave him earlier, did not try to summarize in detail. But if you pull up the one that is called Attachment A, it's the potential project deferral list that both Dwight and Mike have referred to. And it is a list of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 14, well, projects and programs that would be mostly deferred or partially deferred from 2021 until 2023. So these are things that we would do in the next 2 years that would be pushed off. And I'm just going to pick a couple of them because I think the language in here actually gets at what you're talking about. So, for example, the Lake Hills and Northwest Lake Sammamish interceptor upgrade in the city of Redmond is a pipe project, would be deferred until 2023 for construction. And the comments say, we're delaying replacement of a pipe that is currently under capacity and rated in poor condition, increasing the risk of a raw sewage overflow. Going to jump down to the West Point Treatment Plant PE and reactivated sludge pipe restoration and replacement. I don't know what PE stands for in that, but it's within the city of Seattle. It would be deferred until 2023 and is described as delaying replacement of severely corroded process piping, increasing the probability of failure. If the piping fails, there is potential to disrupt secondary treatment, which means the treatment plant itself, until the pipe can be repaired, causing permit violations. So if you look in this, it may not be exactly at the level that you could hand to your average ratepayer and they would say, oh, I get it. But it starts to get at the types of projects. So the original rate that was proposed at 9.5% included what I would call this list of gotta do now type projects, or really ought to do now type projects, or else you're risking sewage failures, right? It also included things we need to invest in for the future to maintain the state of our system so that it is in good shape over a longer period of time. That's the asset management part, right? And so actually it's all asset management, but that's the long-term asset management. And what they did after hearing pushback from representatives like cities and the advisory committees was they said, you know what? Why don't we wait on that longer term stuff? Although I don't know that that was a super easy thing for them to do or that they did it gladly, but why don't we wait on that longer term stuff, and then just only do the things that seem really imminently necessary to maintain the integrity of the system today or into next year. Now, we can obviously ask questions about, second guess, question that, but I think that's what they're saying. What they're saying is that these got to do now things that type projects will be delayed at least for a couple of years, and that is seriously problematic for our system. And I am absolutely happy to be corrected or have any information from any of the more expert people, but that was how I interpreted what I read from Mr. Reed.
That's very helpful. Thank you, Madam Chair.
Thank you. Councilmember Cole-Wells.
Thank you, Madam Chair. I have a question of either probably Mark, and that is when we had the disaster at West Point, I think that was February 2017. Is that correct? And I'm sure all of those of us who were on the council at that time remember that vividly. And one of the follow-up ordinances that we were able to get through the council was a 50-year or half-century study of the condition of West Point, given the massive failure that occurred. We wanted to make sure that we were making corrections and changes so that we would not have this occur again. Are any of the recommendations for inclusion in the funding that would take place if we were to pass the original motion here with the 4.5% increase, ones that came from that study?
I'll cover that. Yes. Thank you for the question, Councilmember Cole-Wells. Yeah, after the flood event, Council directed us to prepare that 50-year assessment as well as revamping our asset management plan, which really focuses on our existing capital projects that repair, refurbish, or replace equipment so that we avoid sewer backups. so that we avoid failure in our system, so that we protect public health. And from that came out a number of projects that we did. Council will remember we went into the AECOM study that identified very specifics. Many of those are in this funding proposal. The return activated sludge project that the chair had mentioned is a critical project. It's one that it is a worn out pipe, is identified as something that needs to be repaired as we got into our asset management work, really our investment. What are we doing there as far as replacing equipment? We have been repairing that pipe for quite some time. It's a piece of equipment that essentially allows the interaction between our system and the secondary treatment. Should that go down, we will be out of the secondary treatment business until we can replace it.
Thank you.
Thank you, Councilmember. Any other questions from members before I call on Councilmember Dembowski to close? Or questions from Councilmember Dembowski if he's prepared, if he wants to.
I have a question for Mark while we've got him. Mark, what I understand is you're not proposing any reductions in staff with this rate. Why did you consider cutting for 3 or 4 years the $5 million a year in the Waterworks grant program, which would be $20 million over 4 years, given that we are in a once in a century economic crisis? If not, why not?
No, we have not considered cutting the Waterworks grant program at this point. It would depend on really the rate setting process and as we go through and implement to see how it affects our budgeting. We have held up all of our non-operations and maintenance hiring.
You haven't cut a single position?
Not yet, no.
All right, colleagues, we all love handing out those checks. I've shown up with the big checks. They do great work, water quality testing up in streams. For a while, they were funding salmon welcome back parties in Issaquah. I think we dialed that down a little bit. What you've just heard is we're not going to turn that off for 3 years or 4 years, $20 million. We're going to raise ratepayers' rates so we can just keep doing it. It doesn't make sense to me. But instead, the division comes forward with a parade of horribles. Of course, nobody wants to see our infrastructure investments not made or delayed longer than necessary. But I've just identified for you a nice to have program, as Councilmember Lambert often calls them, nice to have, but not a single dollar cut there would imperil safety or our ability to treat sewage. I mean, we're funding storm drain repairs with that out in cities. We know it. We see it. I don't believe this budget's been rigorously as the times called for vetted. And I think holding them to zero next year, and Mike, correct me if I'm wrong, but in 2022, they'd get the increase. It's basically pushing it back a year.
That would happen, assuming that you approved in 2021 a 2022 increase. That will be before you about this time next year. Though I will say again, the financial plan assume that 4.5% increase for 2022.
It does presume that in my amendment.
That's correct.
That's correct. So it's a 1 year delay of the rate hike. That's what my amendment does, a 1 year delay. And instead of 4.5 for 2021 and 0 in 2022, I believe it's 4.5 in 2022 and 0 in 2021. And the world's going to fall apart if we do that. Sorry, I hate to be so sarcastic here, but I kind of just don't believe you guys.
Lambert.
Okay, I saw Councilmember Colwell's raise her hand, then Councilmember Lambert. Go ahead, Councilmember Colwell.
Thank you very much, Madam Chair. I have a question, Mark, as a follow-up. My understanding has actually been that Waterworks is really a net positive for water improvement. And to put that on the chopping block would have repercussions. Could you answer that a little bit, please? Thank you.
Yeah, I can't get into the actual numbers, but again, we haven't gone through that detailed budgeting process. But the Waterworks grant money does leverage funding from other agencies, is my understanding.
Madam Chair, may I follow up?
Go ahead, yes.
Yeah, Mark, my question was actually had to do more with the benefits of the Waterworks program.
Oh.
That they're together combined can be a net positive for water improvement.
I'm sorry, council member. I didn't quite pick that part up. I was looking for the leverage factor there. Yes, the Waterworks grant program is very unique in the sense that it does address non-point pollution protection of some stormwater programs, as well as education and outreach to those who are learning about water quality improvements and how they can do their own personal lives to improve our water. And those are all huge benefits to us. It also develops and builds community capacity within the community around understanding and then transferring that knowledge on to future generations. That has been a long-standing benefit to that program.
Okay, Councilmember Lambert.
Thank you. My question is for Mr. Dively. Mr. Dively, I assume that you saw the original list of things that actually needed to be fixed. I was looking for you over there. Now you're over here on my screen. So I assume that you saw the full list of things that need to be fixed in capital. Do you feel that those were a frivolous list, or do you feel that that list was in fact an important list of projects that, should they not be completed, that put our county at greater risk for issues with the Department of Ecology, overflows, endangering potentially employees, the roof should fall in. A number of them have to do with seismic upgrades. How do you feel about the full list that we have pared down?
So I would refer you to Mr. Reed's staff report. And in there's a great graphic that shows the ever-growing asset management needs of the wastewater treatment division because our infrastructure is old in many cases. And so it was the original 9.5% proposal that we were talking about was frankly not enough to really make good progress on that. The executive had frankly wanted to do early on that list of deferred asset management. But even pre-COVID, we felt like going higher than 9.5% was probably not very realistic. So that list was probably too short. What we've taken out and deferred between the 9.5 and the 4.5 is a list of things that, in my opinion, were it not for COVID, you should not have deferred. We really needed to do all of those things, if not more. And to now go down to less than 4.5% and defer even more things, in my judgment, and this, obviously people have different opinions, is not prudent given the situation we face. I would only make one other comment, which is I think Mr. Reed was very clear that if the council were to choose 0 today, we cannot count on 4.5% in 2022 because you have not approved that, and you would not even consider that till a year from now. So for our planning purposes, if the council decides to go with 0, we cannot count on 4.5% next year. So just so as you take these very challenging votes, you are aware of what that circumstance means.
Thank you, Madam Chair.
On point, Madam Chair. I guess maybe this is to close.
Well,
on Dwight. Oh, you do. Okay, on Dwight's last point then, Mike, I want to make clear my amendment, what you did was a 0% rate increase for 2021. That starts in January. But there is an adopted in the amendment financial plan. And you, at my request, changed that to signal a 4.5% increase in 2022. And if members support this, that would be the policy direction. Right now, under the unamended version, it's a 0% increase in 2022. Do I have that right?
You do. You do. In 2022, there would be an opportunity to adopt a corrected or revised rate, and there would be an opportunity to adopt a revised financial plan. So yes, this financial plan does provide for 0% for 2021 and 4.5% for 2022. A revised financial plan or 2022 rate adoption process, if it stayed with the same policy, would again provide for a 4.5% increase in 2022. But there would be an opportunity to revise that if you chose to at that time.
Did that answer your question, Councilmember? Or you're muted if you're trying to talk.
I think it did. I think that was a long way of saying what I said was correct.
Okay.
I think.
Okay, I'm gonna weigh in real briefly, and then I'll call on Councilmember Dembowski to close on the amendment. This is one of those questions in my mind that that demonstrates something I think is very important for us to keep in mind in government, and that is there are very few angels and very few devils. Rarely is something totally wrong and something else totally right. We have to make hard decisions, and we have to lean one way or another and decide what is the best thing to do, sometimes in the absence of perfect information, sometimes knowing things that cause us concern. And I would not say that this proposal, although I'm not going to support it, I'm not going to say that it's totally wrong. There's a key point here that Councilmember Dembowski makes that is absolutely correct. And that is, people are suffering out there, and it's not good enough for us to just say, we can't figure out how to reduce the burden on them, and so we're just going to do business as usual. That is an absolutely correct statement. We need to stretch ourselves now as a government, both to help people directly, but also to keep from harming them by putting undue burdens on them for things that we could defer or delay or do more cheaply now. I think it's really important to just acknowledge a couple of things. First is, and it's been said before, but I want to say it again, the initial proposal for this rate was 9.5%. There was quite a bit of pushback on the 9.5%. It included not just, as I said earlier, money for projects that would keep the system functioning sort of in the now, but it also included the beginnings of what will absolutely have to be in the long term, a very significant investment in our pipes and our equipment. If we don't make that investment into the future, we are not going to be responsible stewards of this system that is necessary for safe communal living of human beings. We cannot have sewage all over the place. You will see public health impacts of that if we can't maintain our sewage system. I think we need to spend some time, no matter what happens today, we need to spend some time with our stakeholders, our colleagues, our contract partners, and the public, making sure that we're being very clear about what the long-range needs are, how we're proposing as a county to fill those long-range needs, and why it costs what it costs. I think that there's been partially something that we as a county could have done better in terms of our outreach and work with our communities. Partially it's COVID, when the meetings would have been happening to have discussions, live discussions with our partners on the Regional Water Quality Committee and others. We were not able to do those things, so the timing was a little unfortunate. Another way, second point in which the timing is unfortunate, is to remember that our utility does not raise rates every year. At least we haven't for a number of years. It's listed out in a chart in the staff report. You have to go back to the 2013, 14, 15, 16 timeframe to see where actually those might have just been a combined rate increase. But in 2017, there was a 5.2% increase, 0 in 2018, 2.5 in 2019, 0 this year, 2020. 4.5 is proposed for today, and 0 again for 2022. So what we do is we take these sort of modest increases in even years, and then in odd years we don't do anything. If we did a 0 this year, we would essentially be in a 2-year cycle with no increases. And truthfully, if that was the only problem, if our revenues were coming in the way they ought to or the way we had projected them to, I think more of us might say, do we need to do this right now? Our revenues are okay. Let's see if we can, handle what is a modest increase, a modest amount of revenue, really. But that's not what's happening. We're facing a potentially major revenue decrease at the same time that could wipe out our entire stabilization fund, which is what we use to keep the rates from spiking, because there's kind of a lot of fixed costs in running this operation. So I apologize to you all. I call on my experience as a city official a lot, but I'm just going to do that again because we did exactly this at the city, exactly this. We looked at our pipes, We looked at our long range needs. We looked at our rates, and we tried to set the right balance between a big nut that we had to pay off to keep these pipes that are now 50 plus years old, some of them in King County probably older, in operating order, against the fact that when you do a 10% increase or more, it really hurts people's monthly bottom line. I think this proposal, it's a difficult time. It would be great to be able to just say we could do zero. I am hearing from the people who I trust and believe understand this system as well as it can be understood, that this modest increase will help us to keep our system in good working order for the next year. I think there's more work to be done between now and next year's decision on this, but I'm going to vote no on the amendment. Although, again, I just want to end by saying I do think reasonable minds can differ on this, and I will now call on Councilmember Dembowski to close.
Thank you very much, Madam Chair, and I agree with nearly everything you said there. You just said it more nicely than me. So a little of my frustration is maybe showing. I've identified just today where I think some reductions could be made. Not a single employee proposed for reduction. I love our employees, but boy, hundreds of thousands of restaurant and hotel workers have no work right now. And we're going to try and get them going again at the end of this year and into next. And about that time, into this proposal by the administration, we'll jack their sewer rates 4.5% and add additional cost burden to every small business in King County, every single one. And our partners at the UPAC have said no. The city of Seattle says no. The SCA PIC says no. They're saying, guys, wait just a year. All my plan does is say, wait a year. If our finances in the wastewater treatment division are so tenuous that they can't stomach a $19 million delay of 1 year, we got a lot bigger problems than a rate increase question. If they are that close to catastrophe, to financial disaster, the parade of horribles that has been painted today, I think it's time we take a hard look at what's going on over there with the finances, that we are that inflexible that we can't respond to a once-in-a-century economic catastrophe. So again, what this proposal does, this amendment would say, wait 1 year from the 4.5% hike. Instead of doing it in 2022, in 2021, do it in 2022. It just flips it. And I appreciate that reasonable minds may differ, but I don't appreciate the lack of sincere effort to come forward with a proposal that would do something other than paint a parade of horribles about how the system's going to fall apart if we don't do it. You've lost your credibility with me on that when you will not look at something as simple as a very valuable program. I love it. I proposed going on the higher rate for the Waterworks program. And I love that program. I love how it functions, and it does a lot of good. But if we're looking at getting the core job done of treating wastewater and balancing that needs against the economic crisis and a policy priority of mine, which is not pile on increased cost to small businesses trying to restart and get through this and keep people employed, I got to, at this time, do what I can to help them out and tighten our belt here at the county. So that's why I think the 1 year delay offered by this amendment makes some sense. Thank you for the opportunity and the rigorous debate.
Thank you, Councilmember Dembowski. At this point, I'm going to call for a vote on Amendment 1. All those in favor?
I think a roll call is probably appropriate.
Roll call has been called for. Roll call
Second.
we had. Okay, Madam Clerk, would you please call the roll?
Thank you, Madam Chair. Councilmember Dembowski.
Aye.
Councilmember Dembowski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Cole-Wells.
No.
Councilmember Cole-Wells votes no. Councilmember Lambert.
No.
Councilmember Lambert votes no. Councilmember McDermott.
No.
Councilmember McDermott votes no. Councilmember Upthegrove.
No.
Councilmember Upthegrove votes no. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai.
No.
Councilmember Zahalai votes no. Madam Chair.
Aye. No, sorry. No.
Okay.
Madam Chair, there are 6 noes and 3 ayes. Those voting aye are Councilmembers Dembowski, Dunn, and Von Reitbauer.
Okay, in the opinion of the chair, the amendment does not pass, although I was so close to the other side. All right, this brings us back to final passage unless there are other amendments. All right, seeing none, any final comments before we call for a vote? Councilmember Cole.
Thank you, Madam Chair, as the prime sponsor. We know the issues well, but I have to remind my colleagues that the horrible disaster of West Point, just a bit over 3 years ago, that no one expected. And it was a miracle that no one died in it. If it had happened a little later in the morning, that likely could have occurred. But I'd also like to bring up what we euphemistically can refer to as the law of unintended consequences. We're talking about $19 million. As Councilmember Lambert brought out, this is the average of $2.04 a month. And I recognize that there are a lot of people without jobs. Hopefully, most are able to get unemployment benefits. We do have our small businesses to worry about. But if there's another flood, if there is another failure, if we don't go ahead with this now and the unfortunate happens, could be a tragedy that happens. We don't know, and that's the point. We don't know. And I respect that the executive branch cut in half basically what it intended to request as an additional fee and increase. But this is a low amount, less than what would be ideal, but I think it's important that we do grant and give this a go-ahead. Thank you, Madam Chair.
Thank you, Councilmember Colwell, and I will consider that an argument to close and ask the clerk to call the roll on this ordinance.
Thank you, Madam Chair. Councilmember Dembowski.
No.
Councilmember Dembowski votes no. Councilmember Dunn.
No.
Councilmember Dunn votes no. Councilmember Colwell.
Aye.
Councilmember Colwell votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Up the Grove.
Aye.
Councilmember Up the Grove votes aye. Councilmember Von Reitbauer.
No.
Councilmember Von Reitbauer votes no. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 6 ayes, and Councilmembers Dembowski, Dunn, and Von Reitbauer voting no.
By our vote, we have adopted proposed substitute ordinance 2020-0186. Thank you, everyone. And that was, I thought, a very good debate, and I appreciated the time and effort on it. Now we will move to proposed ordinance 2020-0173, and I'm going to call on Councilmember Dembowski to put this in front of us.
Thank you, Madam Chair. Move adoption.
All right, proposed ordinance is in front of us. We have Nick Bowman with us to provide a staff report. Welcome, Mr. Bowman.
Thank you very much, council members. Good afternoon, Nick Bowman, council central staff, for the record. Materials on this item begin on page 39 of your packet. Proposed ordinance 2020-0173 would authorize the executive to enter into an interlocal agreement with the Cedar River Water and Sewer District to complete a coordinated project that would replace a failing culvert, make road and stormwater improvements, and relocate a water main, sanitary sewer lines, and related fixtures in the Fairwood area of the unincorporated King County. Roads has determined that in order to complete its culvert and road improvement project, a portion of the district's infrastructure located in the county's right-of-way will need to be relocated. Under its franchise agreement with the county, the district is responsible for the relocation of any infrastructure utilizing the county's right-of-way. The proposed ILA, which is attachment A to the proposed ordinance, would set forth the conditions to bring the two projects under one contract, with the county acting as the lead agency. For a bit of background here, in the 2017-2018 annual budget, the council approved appropriation authority for roads project 1130707. This project was derived from a work plan developed by the Water and Land Resources Division to identify and prioritize projects which would improve access and reduce risk to communities isolated during recurring flood events on county roads. The current total cost estimate for the project is approximately $4.9 million. The roads portion of the project is estimated at $3.3 million and will be funded by the King County Flood Control District. and the Willard portion of the project is estimated at $1.5 million, which is funded by the surface water management fees appropriated to the Stormwater Capital Asset Prevention Program. The Cedar Water, River, and Sewer District is a water and sewer district as defined under Title 57 Revised Code of Washington. The district was formed on June 21st, 1960, area of about 14.5 square miles. Currently, the district serves the communities of Fairwood and Maple Valley. The proposed ILA before you today outlines the scope of the projects, which are defined as the county project and the water main and sanitary sewer lines relocation project. The ILA describes the individual responsibilities of both parties, and it provides the cost estimate on which payment by the district to the county will be based. According to the executive, coordinating the work under one construction contract will achieve cost and project efficiencies for both the county and the district, as well as reduce construction disturbances to the general public. There are timing considerations, as the construction window for this project is fish dependent, meaning permit requirements stipulate the construction must occur when fish are not expected to be present. According to the executive, the ILA would need to be approved by the end of May to complete the work within this year's construction window. And finally, there's an amendment. Amendment 1 would replace the original ILA with a revised ILA, which would make technical and language corrections as recommended by council's legal counsel, add protections for the county in the event the district unreasonably delays the county's contractor in the performance of either the county or the district's project, clarify that the district is responsible for and has sole jurisdiction over inspection of the district project, and that the district will coordinate its inspections of the project with the county, as well as conduct its inspections and share its inspection results with the county in a timely manner. Stipulate that direct and indirect costs incurred by the county and charged to the district shall not exceed 25% of the construction costs, and includes a complete cost estimate for the district project construction costs under Exhibit A to the ILA. This increases the estimated payment to the county by the district from approximately $135,000 to approximately $208,000. There is a crosswalk provided on page 60 and 61 of your packet, which shows the key changes in each section of the ILA, but I will not get into that unless requested. That concludes my staff report. Roads Division Director Rick Broder is here, and both he and I are happy to answer any questions you may have.
Okay, thank you. Thank you, Nick. I appreciate that report. Are there any comments or questions on the item? It is before us.
Madam Chair, move adoption of Amendment 1. Councilmember Dunn, this is his district, has worked very closely on this project. It's an interlocal agreement. There's a fish window issue, which makes it necessary to move now, and he asked if I'd move it on his behalf.
Okay, so Amendment 1 is before us. Would anyone else like to ask? I have one question about it, and that is anything in Amendment 1 change the position of our negotiating partner, the district, with regard to this? Is this going to upset any agreements that we have with them?
No, they've already signed the revised ILA.
Oh, excellent. Well, that is make things simple. Any other questions or comments? Let's move quickly. All right. I'm not seeing anyone else raise their hand. I'm going to call for a voice vote on Amendment 1. All those in favor, please signify by saying aye.
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 Any opposed? Amendment 1 carries. Now on final passage, is there a title amendment? I'm sorry, I should ask that first.
No.
Title amendment. All right. On final passage, Councilmember Dombowski, would you like to say anything more in closing?
I think Nick did a great job on the staff work, and I think it's ready to adopt.
Rather complicated, but it came across pretty simply, so thank you for that. All right. Madam Clerk, would you please go ahead and call the roll?
Thank you, Madam Chair. Councilmember Dombowski.
Aye.
Councilmember Dombowski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Cole-Wells.
Aye.
Councilmember Cole-Wells votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Upthegrove.
Aye.
Councilmember Upthegrove votes aye. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 9 ayes, 0 noes.
By a vote, we've adopted proposed substitute ordinance 2020-0173 as amended. That brings us to proposed ordinance number 2020-0184. I've sponsored this one. I'm going to call on Councilmember McDermott if you would to make the motion for me.
So moved, Madam Chair. I mean, we adopt the ordinance.
Thank you for the motion adopting ordinance. And this is the item regarding the Juvenile Detention Guild Collective Bargaining Agreement. I understand we have Cliff Curry with us, and I see him there on the line to give us a brief overview. Please go ahead, Cliff. Welcome.
Thank you, Madam Chair. I appreciate it. Good afternoon, council members. I'm Clifton Curry of council staff. The materials for this particular item begin on page 67 of your materials, with an OLR staff report on page 141 and the fiscal note on page 147. This proposed ordinance would ratify the collective bargaining agreement with the King County Juvenile Detention Guild for the period of January 2019 through the end of this year. This negotiated collective bargaining agreement was ratified by the unit after mediation. It covers approximately 110 employees, including detention officers, community surveillance officers, and other employees who support juvenile services at the New Children and Family Center, Justice Center. This particular negotiated CBA is in line with other recently adopted agreements that you have previously discussed and approved. It carries the same key provisions as other Department of Adult and Juvenile Detention CBAs related to leave and a variety of other issues. It conforms with the King County Master Labor Agreement and makes the changes needed by other King County Code provisions. It will make changes very similar to those adopted for DAJD corrections officers that standardize provisions and clarify a variety of sets of languages. And according to the executive, the agreement creates a substantial improvement in DAJD's ability to manage staffing resources and achieve the goal of reducing mandatory overtime. There is a general wage increase that conforms with the MLA agreement increases for 2020. And the fiscal impact of the agreement is approximately $379,000 for 2019 and $288,000 for 2020. And we've been advised by the executive's office that there is no need for supplemental, that these funds have been reserved. And with that, Madam Chair, unless there are any questions, I'm turning it back to you.
Thank you, Cliff.
Lambert.
Councilmember Lambert, please go ahead.
Thank you. Are they part of the master labor agreement? And is there anything different from the master labor agreement in this contract?
I would have to defer to a representative of OLR. Generally, they conform to the many sections of it, but I'm sure there's some that do not necessarily conform to the whole master labor agreement, basically because of the different set of work there.
I understand that we have Bob Railton and Diana Watkins on the line potentially to answer questions from the executive branch if they are available to do so. I'd ask them to speak up at this point if they have anything to add.
Yeah, this is Diana Watkins. They are not part of the coalition of unions, so they don't belong to the master labor agreement. But this new collective bargaining agreement does align a lot of the provisions with that agreement. So the vacation carryover limit, the floating holidays, no reversion of donated leaves, some of those provisions. And like Cliff said, the wage negotiated for 2020 is the same as the master labor agreement.
Did that answer your question, Councilmember Lambert?
Thank you. And I'm hoping that soon we will get even more onto the master labor agreement. Do we know how many are on the master labor agreement now?
Again, I would have to defer to OLR on that, but I know it's a significant number.
I believe it's 65 out of 75 units. Bob, do you know?
Members of the council, Bob Railton, Deputy Director for the Office of Labor Relations. Yes, that is correct.
I'll be so happy when it's 75 out of 75. We're getting there. Thank you.
All right. Any other questions on this item before we take it up? I just want to add that this is the first time that Diana Watkins will be appearing before the council. Normally in chambers, we would take the opportunity to welcome her and potentially ask her some, difficult questions. But under these circumstances, I think it's probably not kind. But you may all know Diana because she worked for many years at APHIS, and now she's in labor relations taking on these contracts. So we're really glad to have you in this new role. It's nice to see your name.
Yes, and I appreciate the abbreviated welcome process.
Yeah, we'll get you another time. We're just going to bank that one for now. All right.
Okay.
Thank you for your work on this. All right. With that, I'm going to ask the clerk to please call the roll.
Thank you, Madam Chair. Councilmember Dembowski.
Aye.
Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Cole-Wells.
Aye.
Councilmember Cole-Wells votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Up the Grove.
Aye.
Councilmember Up the Grove votes aye. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, that is 9 ayes, 0 noes.
By our vote, we have adopted proposed ordinance 2020-0184. We'll move on to proposed ordinance number 2020-0185. And again, I would ask if Councilmember McDermott would please move this for me.
Madam Chair, I move adoption of ordinance 2020-185.
Thank you. And this one is another collective bargaining agreement, this one between the International Brotherhood of Electrical Workers Local 77 in the county. And we have Leah Krekelzapi to provide a brief overview. Please go ahead.
Madam Chair, it's Jeff Mum. I need to fill in for Leah today. So okay. I promised her I won't screw it up too much.
Okay.
For the record, Jeff Mum, Central. Yeah, yes, Councilmember.
Don't make promises you can't keep.
Yes, I qualified it with 2.
Okay.
Did not screw up too much. I thought that was wise, actually. Please go ahead.
Thank you. It's always good to start off on a good foot here. So proposed ordinance 2020-0185 would approve a collective bargaining agreement for electrical workers represented by IBEW Local 77 in the Metro Transit Department. The materials for this item you'll find on page 153, and then the of your packet, and the report put together by OLR staff is found on page 209 of your packet. So there are about 90 employees in this bargaining unit. And what they do is they repair and maintain electrical systems for the transit bases, light rail facilities, park and ride lots, and the downtown transit tunnel. Their work includes overhead power lines and substations for Link Light Rail, the streetcar, and trolley buses. The fiscal note states that the financial impact of the agreement is about $1.6 million over the life of the contract. So that runs from 2019 to 2022. With $865,000 of that expended in the next biennium, in 2021-22 biennium. These financial implications are a result of the general wage increase, and those general wage increases are as follows. In 2019, it was a 4% increase. In 2020, there's this bifurcated increase, so 1.5% from January to the end of June, and then another 1.5% from July 1st to the end of the year. And then in January, or in 2021, there's a 3% increase and a 3% increase in January of, or in 2022. And it's my understanding that this also, that these general wage increases are in line with the ATU contract that was just ratified. There are no other major issues in the agreement, and I'm happy to answer any questions.
Okay, thank you, Mr. Mum. And I understand we also have the labor negotiator from OLR, Sasha Alessi, with us today. If there
That's
are
right.
questions. Welcome. I hope you were on the line earlier when you heard the nice compliment from the IBAW representative who said that you were, let me get this straight because it was quite lovely, open and honest and did a great job. So congratulations on that. That's always good to hear.
Thank you very much, Madam Chair.
It wasn't from me. It was from your bargaining partner. All right. So questions and comments, council members, on this item. I'll just jump in, and I have one. So on the same theme of the discussion we just finished with the sewer rates, I want to honor the negotiations that we have completed, because they don't happen in a few weeks. They happen over a period of many months. And I want to make sure that we're being fair. And I heard that this tracks with the larger bargaining unit in the Metro Transit Department. So that all makes sense to me. at some point, we're going to have to engage in a conversation with all of our labor unions, not any particular one, not just IBEW or JDG or any of these particular ones, but with all of them about how we handle the crushing loss of revenue that we are about to face. And I know that the executive has begun to have very preliminary discussions with the labor unions, but I just want to, put a word in as a council member that we will need to, in my opinion, all things will have to be on the table. I don't think we do that now as we update, as we take up contracts, but I think that we have to set the tone that we need to partner with our employees and with their labor unions to make it through this next time. So I'm going to be voting yes on this contract. It seems to have been fairly negotiated. It seems to have come out of a very collaborative labor relationship, and that is always something that I want to encourage and support. But I do think that we can't get through all of these items without putting on the record that we're coming in for a very challenging time and one that we're going to have to talk to our labor partners and work with them to get through. So any other comments or questions before we move to a vote on this item? Councilmember Lambert?
Thank you. I just like a piece of information. I realize that now that we have 86.6% of our labor on the master labor contract, that for some of the other almost 14% who are not, that we are incurring extra costs, extra bookkeeping, extra lots of different things. And I think it would be good to get a list of what all those extra costs are so that we can begin to say, is it really worth to them and to us and to the taxpayers those extra costs, when if it were all done as a system, we wouldn't be incurring them. So when we were at 0, I thought that was a good idea. And now that we're at 65, I think it's even better idea. So if we could get that number, I think that would be, those numbers, I think that'd be very helpful. Thank you.
Thank you, Councilmember. I'll work with OLR on that.
All right, thank you very much. Any further questions or comments? Madam Clerk, would you please go ahead and call the roll?
Thank you, Madam Chair. Councilmember Dimbaski.
Aye.
Councilmember Dimbaski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Colwells.
Aye.
Councilmember Colwells votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Up the Grove.
Aye.
Councilmember Up the Grove votes aye. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 9 ayes, 0 noes.
By our vote, we have adopted proposed ordinance 2020-0185. The next item is the hearing examiner consent agenda. Madam Clerk, would you please read that item into the record?
Thank you, Madam Chair. Item 12 is proposed substitute ordinance number 2020-0065, authorizing the vacation of 10273 147th Avenue, Southeast 98059. Petitioners are Troy and Kathleen Solly.
Councilmember Dimbaski, would you put that item before us?
Move adoption of the street vacation.
Okay, that's that item is before us. Madam Clerk, would you please call the roll?
Thank you, Madam Chair. Councilmember Dimbaski.
Aye.
Councilmember Dimbaski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Colwells.
Aye.
Councilmember Colwells votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Up the Grove.
Aye.
Councilmember Up the Grove votes aye. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai. Councilmember, thank you. Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 9 ayes, 0 noes.
By our vote, we have adopted proposed substitute ordinance 2020-0065. Now we have first reading and action on motions without referral to committee. And the first one is proposed motion number 2020-0190. Madam Clerk, would you please read that into the record?
Thank you, Madam Chair. Item 13 is proposed motion 2020-0190, setting the county's priorities for allocation of CARES Act funding in excess of the funds needed for the county's direct response to the COVID-19 pandemic.
Thank you. Councilmember Cole Wells, would you put that before us?
Thank you, Madam Chair. I move proposed motion 2020-019D having to do with council COVID-19 priorities.
Thank you, Councilmember. It is before us. Would you like to give a few words of introduction before we have the briefing from Mr. Hamaker?
Sure. Thank you, Madam Chair. As you know, I had requested all of you, my colleagues on the council, to provide me with your 5 top policy priorities for the next COVID emergency omnibus ordinance that will be coming to us on June 11th or thereabouts. And I thank you all for submitting them on time. And I was able to work with Dwight Dively from the budget manager for the office and for the county in informing him that what we really would like to do from now on with our COVID emergency omnibus ordinances, and we are going to have some number of them, is to work proactively with the executive branch to develop rather than solely react to these ordinances that are transmitted to us. And last week, and by the way, Dwight was very gracious about that and did let me know that that would be fine and it would in fact be very helpful. And I'd also like to thank Councilmember Balducci for her working with me on that request. Last week, I worked with the council's new COVID leadership team, which I created along with our council chair, and that consists of myself and Councilmembers Dombowski, Dunn, and Balducci. We met to highlight those priorities of most import to the council members. And we sent out a request to you as well for your guiding principles. And we were very pleasantly surprised.
Councilmember Colwell, were you done?
I'm sorry.
You were pleasantly surprised.
Okay, we were pleasantly surprised that there was a great deal of overlap among all the council members' policy priorities as well as the guiding principles. And so what I worked on from that meeting last week was an proposed ordinance that you have before us. And this motion highlights, one, that council members were very interested in getting money out quickly to the community while still having the ability to monitor spending and provide oversight. And this means that where possible, we recommend that the county provide additional funding to existing programs that work and are important. Second, the highest priority should be to make sure that the county's public health system should be topped off and ready to address any additional spikes that might arise as the region begins to reopen. And third, after that priority is funded, the council members identified 4 key areas that should be priorities. These are food security and access, housing stability and homelessness services, services to aid the economic recovery, and mental health, behavioral health, safety, and security programs. And as I'm sure you all can likely understand that each of these priorities likely could contain many different programs, but we did resist the urge to come up with long lists of policy priorities and requests in this motion. Instead, we adopted a few examples or included a few examples in each category. Well, what we want to do is to make sure that we have flexibility as the situation in the county changes, but also to avoid spreading the limited federal funds so widely that the impact becomes watered down. We do also have a title amendment to correspond to some changes that we made at the last minute. As you hopefully recall in the memo that I forwarded to Dwight Dively last Friday and copied you all on, we contain a lot of supporting documentation based on what you all recommended. So with that, Madam Chair, it's give you an overview and Patrick can fill in some of the dots.
Thank you very much. Mr. Hamaker, thank you for being with us. Please go ahead.
Thank you, Madam Chair and council members. For the record, Patrick Hamaker. Actually, I think Councilmember
Cole-Wells hit all of the key points that I would want to hit. I think maybe I'll just very quickly go through the structure of the motion because that was just released recently. As council member, there's basically 5 sections of the motion. As Councilmember Cole-Wells noted, the highest priority has been identified, essentially topping off any public health resources that might be needed for a second potential wave that might occur between now and the end of 2020. As council members are aware, the CARES Act funding and the Coronavirus Relief Fund specifically needs to be expended in 2020. So that is of importance that it be out quickly. Section B of the ordinance really lays out the principles that were identified by council members in putting this motion together. And that foremost amongst those was meeting the residents' basic needs, especially for food and housing stability, and ensuring uninterrupted delivery of core services. Section C was also kind of a principles approach that where possible that funds should be prioritized to existing programs that can quickly get relief out the door as opposed to creating new programs, and that the county should prioritize a narrow range of services as opposed to trying to fund lots of services to make sure that the impact is most effective. And then section D, the last section, is the individual listing of the 4 highlighted priorities that Councilmember Cole-Wells went over. So those were food security, housing stability and homelessness services, programs that would impact the economic recovery, and then the mental health, behavioral health, and safety programs. And the final section is just that the council requests the executive prioritize these principles in proposing to the council future supplementals from the CARES Act fund. So I'd be happy to take any questions you might have, but that concludes my briefing.
Okay, thank you, Patrick. I appreciate that summary. Members, any questions or comments? Councilmember Upthegrove? Well, you're unmuted. I just assumed that you were getting ready to speak.
I apologize. That's from the last vote. I didn't read it.
Well, you can say something if you like, though.
Hi.
Okay, hi. Anybody else? Questions, comments? I will jump in here and say one thing. I really appreciated this approach. I appreciated the work. We did 2 surveys of the various offices so that our individual interests and priorities were collected, tried to find commonalities, and especially the upfront way that we're providing interests and principles to the executive branch before they put forward a proposal. I just think this is a wise course of action, and I think it was well done. It was very helpful to me to level set, to have all the information. And so I hope that this will make for, we're going to go into a very challenging pre-budget season and then budget season, not only because of the topics, not only because of the high level of need and the revenue impacts that we're facing, but because we're going to have multiple budget waves, one after another, and sometimes at the same time. So I think that approaching this way so that we hopefully receive a product from the executive that is aligning our interests as a council and representing our districts along with his as a countywide and implementing branch. I just think it's we're setting ourselves up for as much success as we can in these kind of crazy, challenging times. So I appreciate the work. I enjoyed being involved with it, and I will vote in favor. Any other comments?
Madam Chair?
Go ahead, Councilmember Cole-Wells. I understand there's we vote first, then there's a title amendment. Please go ahead.
Sure. I just wanted to point out that the email that was sent out to you last Friday does include just about everything possible in it. There are many different attachments, so you are able to look at that. There are 4 different Excel spreadsheets that show what the priorities were based on a weighting of them from 1 to 5. Also ones without any weighting. The one that we referred to as the red and blue document, and I don't remember right now how that was labeled. Patrick, do you know that? How it was labeled?
I think it was just labeled the council member categories.
So what we did in that one, and I'm speaking as a qualitative oriented social scientist in my background, was to present a summary of all of them. It was not to place value on one or more of any of the policy priorities identified by all of you. It was just a summary, and we broke them down into 4 different categories, which we've elucidated, or 5 of them in this one, and elucidated to you. The 5th one includes the public health infrastructure. And you can look those and just see what some of the more specifics were that were identified by all of you on the council. And I hope this will all be helpful. And my intention is to prepare something similar with your input, not my decision entirely here, but with your input on subsequent COVID emergency omnibus ordinances that are transmitted to us. So I hope you will support this. It involves a lot of work. I'd especially like to thank Adam Cooper, my chief of staff, and Patrick Hamaker for all of their work in assisting me on preparing this. Thank you, Madam Chair.
And Madam Chair, this is a little bit odd because there's only a title amendment. So that needed. There's no other amendment. It's just a cleanup that's been recommended by the PAO and the council's legal counsel.
And to the point of having multiple things crossing each other and moving very quickly. So thank you. With that closing remark and reminder of process, Madam Clerk, would you please call the roll?
Wait, Madam Chair, we have to vote on the title amendment.
I thought we voted. Oh, okay.
So I would like to move title amendment T1.
I'm easily tripped up. T1 is before us. All those in favor, please signify by saying aye.
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 Any opposed? Title amendment carried. Now on the ordinance motion as amended.
Thank you, Madam Chair. Councilmember Dembowski.
Aye.
Councilmember Dembowski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Colwells.
Aye.
Councilmember Colwells votes aye. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Upthegrove.
Aye.
Councilmember Upthegrove votes aye. Councilmember Von Reitbauer.
Aye.
Councilmember Von Reitbauer votes aye. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 9 ayes, 0 noes.
All right, by our vote, we have adopted proposed motion 2020-0190 as amended. Item 14 is a motion requesting the county treasurer to provide payment agreements for 2020 property taxes. Councilmember Dunn, before we have this read into the,
you covered it, Madam Chair.
I covered
read into the
You read
record.
it. You read it.
I read it myself. How about that?
Yep.
Councilmember Dunn.
You did a very good job writing that in. Thank you, Madam Chair. I need to say a couple words before I ask that this be held for another meeting, or rather re-referred, to the Committee of the Whole. This is a property tax payment plan structure that I've been in intense negotiations with the executive branch, and those negotiations are going quite well in terms of modifying our existing payment plan structure, and we do have one, to make payment plans applicable to the current year. Right now, we have a payment plan. If you're a year delinquent, this would allow folks to make a payment plan more quickly, and we're looking in the possibility of waiving late fees as well. I'm very happy that I think this has a good chance of becoming something that is offered to the public, but it needs to be completely agreed upon by the executive, and also needs to be agreed upon by the council. The reason why I'm taking so long to speak to this is this issue. I don't have any guarantees yet by either the executive or this council that it's something they're going to adopt. So those who are watching this meeting, interested in this issue, just know this. The deadline is June 1 for the payment of property taxes. It appears that the interest calculation is something that is state law requires to be done. And so even if this program is passed by the council, that would happen in June. And if you are at all able to pay your taxes, property taxes now, I recommend you do so, because we don't know about the late fees, and interest fees do apply. However, we're going to have a good, robust discussion, I hope, at COW as soon as possible to determine whether this is feasible and move it forward. With that said, Madam Chair, I'd ask you respectfully refer this to the Committee of the Whole, and I will talk with the chair to see if it can be held next week. Thank you.
Okay, thank you, Councilmember. Madam Clerk, is it sufficient for me to just say that instead of taking action on this, we will instead refer it to Committee of the Whole?
That does, Madam Chair. I consider that a motion that's been taken.
Is there any objection? I'm not seeing any objection from members, so without objection, let's do that.
Okay.
Bringing us to our next item, proposed motion 2020-0193. And Madam Clerk, please read that one into the record.
Thank you, Madam Chair. Item 15 is proposed motion 2020-0193, approving a report related to capital project 1138678 DES LTLF Renton Red Lion in compliance with 2019-2020 biennial budget ordinance.
Thank you. Since I'm the sponsor on this one, I'm going to again ask Councilmember McDermott if he would move it for me.
Thank you, Madam Chair. I move adoption of motion 2020-193.
Thank you, Councilmember McDermott. It is before us, and we have Department of Community and Human Services Director Leo Fleur with us today to give us a brief presentation on the status of this item. Welcome, Leo. Thank you for joining us.
Thank you, Madam Chair. My pleasure to be here. For the record, Leo Fleur, and I work for King County's Department of Community and Human Services. Before the council is a motion with your choice whether to accept a report. The report was directed by proviso, and the questions presented were an explanation of the rationale for the siting of a de-intensification shelter at a hotel in the city of Renton, and then also a second question as to rationale for why the executive would seek to extend the current lease agreement. The current lease agreement is a 90-day agreement on the property, and that agreement would expire under current terms at the end of June or right before July. The, I think, theme leading into the report is recognition that has surfaced actually in many of the topics before the council today, which is our shared understanding and recognition that in this crisis in particular, but always, all of our health is connected, all of our common economy is connected, and in fact, our shared health and economy are interdependent across the region and across the full population of King County. We wanted first, in answering the first question, to provide some context about the urgency of the original siting decision. At the time that we authored the report, unfortunately, and echoing a recognition at the beginning of this meeting, there had been 90,000 persons in the United States who had died with a COVID diagnosis last week. Today, I believe that number is a couple hundred short of 100,000. And so it has been clear and continues to be clear that we're dealing with a virus of exceptional lethality. Points of comparison that we were looking for just to demonstrate urgency. It really, you have to go to war, at least in recent memory, to find something this sudden and this lethal. And it's not a comparison that I make lightly on the day after Memorial Day. But 100,000 people is clearly an indicator that we're dealing with an exceptional circumstance. I think unprecedented has been a word that we use a lot these days. The other thing that we certainly have seen from the very beginning, and also just to explicitly acknowledge this, in taking direction and guidance from members of this council, was our internal values, but also your prioritization that we be sure that we are conducting equity and social justice analyses in making these decisions. As part of the continuous improvement that resulted after our first set of siting decisions that had happened in the very first days of the pandemic, the Office of Equity and Social Justice for King County has collaborated with a consultancy to develop a equity impact awareness tool. That tool is something that we used in assessing sites for this hotel and other hotels since. And the concept of that tool is to take a look at many of the factors that correlate, many of the social or the determinants of equity that really drive inequitable outcomes and that really underpin a particular community's ability to remain resilient in the face of government decisions. and then to use that tool when we were accounting for where we would seek to place the interventions that we have placed. And so we did use that tool in this analysis. In this case, we use it on all the things that we cite right now, but with Renton in particular, on a scale of 8, different parts of Renton score either 2 or 3, where 8, the highest score, connotes the lowest ability of a community to remain resilient in the face of a government intervention, and therefore the highest likelihood of ongoing effects that would exacerbate inequities. And then lower scores indicate a confluence of factors that indicate higher rates of resiliency for a particular community. In other words, that they would have the ability to accept, mitigate, or work with the effects of a government decision. And again, Renton comes in at a 2 or 3 there. The other aspect of equity and social justice that we've certainly accounted for, and this is really the set of questions that come in from an equity impact review. The first question is, who is the group of persons who is going to be most affected by a decision? And then amongst those folks who are impacted, who is least able to access the process typically? It is continuing to be the case that in our analysis, there is no group that is more vulnerable, more affected, and least able to affect government decisions than persons experiencing homelessness. And I think we can also very clearly identify that any community in which we cite a facility also is impacted, and that one of our responsibilities is to continue to work with any community in which we cite a facility to mitigate the effects, to continue to support the shared goals of both, in this case, being able to support a group of folks who we believe their health benefits tremendously from an intervention here in the form of the hotel, and also acknowledging that we also have to serve a community and partner with the city of Renton in this case, that Renton is an essential partner in our shared work around COVID specifically, but also homelessness generally, and that we have an ongoing obligation to meet those, to really live into that relationship. And I'll list a couple of the specifics when we get to that part of the report. The other piece of context that we really highlighted is this evolution of approach. As Deputy Executive Smith mentioned at the beginning of the council meeting, we do see very clearly that it is in congregate settings where people are most vulnerable to COVID-19. And then we take a look at the demographic characteristics of a population, and it is persons of color, communities of color are correlated more closely with higher rates of illness and death. Age, so the older folks are, the more certainly we see a dramatic increase of the percentage of deaths once you get up over age 65. And then there's also the presence of certain underlying health conditions or disabilities, and all three of those personal characteristics really show up in a large way amongst the homeless community, disproportionately amongst the homeless community. And all of that really identified that it was congregate shelters that we really wanted to move quickly on. We first adopted a principle of trying to de-intensify by spreading out within congregate settings. A good example of that is an airport, King County Airport shelter that we opened to move the St. Martin de Porres shelter into. And what we saw there was that you can still have rapid spread of the disease amongst vulnerable persons, even in congregate settings, despite the fact that their beds might now be 6 feet apart. And so the only large outbreaks that we've had in homeless facilities inside of King County to date have been in those types of facilities that were still actually congregate, but we had spread out. And so that really signaled to us that we needed to adapt our techniques. And then one of the innovations that really came there is the idea that we might be able to keep people healthy before they get sick by putting them into a single room setting in the form of a hotel. King County has hotels that we have leased or that we have worked with a operator to lease now in Bellevue, Renton, SeaTac, and then 2 in Seattle. And then there are large numbers of hotel vouchers that we have funded where we do not establish a lease, but the provider provides those vouchers, and those are additionally located right now in Redmond and then again Seattle primarily. These facilities make up a set of 18 county operated facilities that are new either by construction or use across the county. The vast majority of those are within Seattle. And then I believe Bellevue is the only other city that has more than one facility. And all of this is contained both on a map and a chart within the report. When we count additional similar de-intensification actions undertaken by the city of Seattle, the total count comes up to 23 of these new facilities that have been constructed in less than the last 3 months. When we were taking a look at where we would apply all of that context to site, we had the facilities management division that was going out and seeking hotels. And at the time, the hotels that they were able to, sorry, facilities that are new by construction or use across the county. Technology issue there. Let me put this out here.
This is kind of fun for me to watch. You're doing great, Leo.
Like the Marco Rubio water drinking incident.
I apologize for that. I definitely just put my computer outside the door, not knowing how to make it quiet so that I would be able to continue this brief. In actually making the location decision, it is very much a matter of what was available, what was affordable at the time, given the context and the urgency. The facilities management division identified 3 hotels. 2 of those were in the city of SeaTac, and 1 of those was in the city of Renton. And then there was a 4th hotel that was available in the city of Bellevue that we ended up not being able to use because the Sophia Way shelter had identified its own hotel that it preferred to work with within the city of Bellevue. And so that really became the rationale for why we chose to site the hotel at, or the facility at the hotel in Renton. What we have seen since is what we think is a remarkable record of success very early on. And I do want to stress very early on. Certainly, we do not want to overstate the success, but so far we have seen that the hotel has succeeded, certainly beyond my expectations, in its primary goal, which was to slow the spread of the disease amongst a vulnerable population. Empirically, what that looks like is we now know that there have been over 200 tests for COVID-19 for guests who are at the facility, and we have had no positives so far. And it is certainly very difficult to characterize the counterfactual, but I do not believe that would have been the case at the old DESC main shelter, from which a lot of the residents who are currently at the hotel would have been the case. Although, I have to be clear that I can't, prove that counterfactual. The other thing that we've seen at the hotel is that we have a significant amount of just personal improvement of the residents who are there. And I think it stands to reason this is a group of county residents who have, the courthouse and the council is very familiar with the residents at the Red Line, because many of them were in the shelter that was across the street from the King County Courthouse for a very long time. And there has been both media coverage and then also included within the report some of what I think are markers of success for our ability to provide a dignified place for people to be able to sleep. And in some cases, as you heard from public comment, people to be able to begin to transition beyond shelter into housing or employment. I think it's also responsible and necessary to acknowledge the fact that the placement of this facility or any facility certainly has impacts on any community in which we put them. That has been the case in Renton. The pattern that we have seen with any facility that we've located is that they take about a month for us to really figure out how to operate, or for the operators to figure out how to operate them. That the number of issues tends to decline over time. Although I think it's also important to be candid with everyone that that is not to say that there will be no issues ever with any facility. I don't think that we could responsibly represent that. And we certainly think that we are seeing that at the Renton Red Line right now. But our responsibility is not to wait for that kind of decline. Our responsibility is to work proactively with the city of Renton, with the operator, DESC, to do everything we can to help drive any incidents down and to force or make that reduction possible and likely. So in working with the city of Renton, in addition to $500,000 that the council has identified for use in mitigating the effects of facilities like this upon local communities, we've been working with the city of Renton, meeting with them regularly. Some of the goals that we take up are relatively modest, but I think important. So one of the goals most recently was what can we do in speaking with the fire chief, the city manager's office, the police chief, what can we do to drive down the rate of 911 calls, for example. We've taken some steps that we think are going to be helpful there, not the least of which include shutting off phones for external use at the facility, which is something that we've imported as a practice from other hotels that we're using successfully in the county. And then also really working on what are the protocols when somebody might still call 911 for to receive care. What are the protocols to help triage that call, make sure that residents, make sure that first responders, make sure that providers are informed and we can make good decisions about how to use Renton's resources and also how to protect and provide healthcare services to the residents of the hotel. I would like to just acknowledge and thank the city of Renton, who on this point, I think has both been clear that they have concerns about the number of calls, and we're working with them on that, but they have also been clear that they take seriously their obligation to ensure that they are responding and providing emergency services for anybody who is in the city of Renton. And we certainly have seen that level of dedication and are thankful for it in the way that the city of Renton's emergency services have responded to the hotel. Looking forward, the other item that the report really touches on are what are the conditions looking forward that would justify continued use of the hotel, but I think also, just what are in general the sets of conditions that we're hoping to build to establish to make permanent the gains that we see happening within this population specifically, but the homeless population more largely in King County. One of those sets of conditions is access to a sort of equivalent space. I don't think any of us are invested to a particular location, even as the cost that it has on moving people between locations, especially during a pandemic. But this is far less about a particular building and absolutely about a broader set of criteria that really identify the fact that single room settings are safer than our congregate settings. Another condition that we are looking at going forward is that all of the underlying medical facts are still there. We are still in an extremely lethal, pandemic. We still do not have any medical intervention that has been proven to prevent or reduce transmission. We still do not have access to a treatment that can, in a proven way, make it so that any of our other extreme social distancing interventions would be less warranted. And it is really at the heart of it, those two sets of conditions. There are others that are contained within the report that we are looking at going forward. I think in summary, and then subject to any questions that members of the council may have, the council members mentioned earlier today, that this requires a different type of approach. The urgency of the situation is unprecedented. We certainly see that right now. And we did something, we've done a number of things in our response that were out of the box or different. And this is one that we see that is working. It is one that we see not only works in the context of COVID-19 and this emergency, but also I think has really important lessons for how we might approach a much longer term and intractable problem around homelessness generally, and unsheltered homelessness and chronic homelessness. And it's one that the council just coming in and out of the courthouse over the years will have seen and recognize the fact that the way that we were doing it before is not something that we believe that we would go back to lightly, and that we should be able to undertake extraordinary consideration and continue to try and then find where successful these new types of interventions that can really help us solve a problem that we've not been able to solve to date. So we are grateful to the city of Renton. I think it's an obligation that I undertake personally, and then also with my partners in other departments to continue to speak, work with, and collaborate with the city of Renton to mitigate effects and that we also just want to emphasize that in this pandemic, in this situation, which layered on top of a pre-existing homelessness crisis, we appear in early returns to have identified an intervention that works both to preserve the health of people now and serves to potentially serve better a group of folks that we have not been able to provide adequate services to for what has been years now.
Mr. Floor, are you done now?
That's what I've got. Councilmember, subject to any questions.
Thank you very much. The motion before us is to approve the report. Comments and questions. Councilmember Upthegrove?
Are comments appropriately?
I said comments or questions?
I will take it. Thank you, Madam Chair. And earlier in the meeting, you told someone their brevity will be rewarded. And I'm worried I'm not going to be rewarded here. And if my colleagues will indulge me, these public meetings are one of the few chances to really go on the record publicly and to clarify our positions and our values. And with this being an issue of great interest in my district, I wanted to take that opportunity today. First, I wanted to thank Leo and the department. I think they took the responsibility of this proviso seriously and met the requirements of the proviso. I also wanted to note the city of Renton, if they've not transmitted already, is going to offer some comments on the report. And I encourage my colleagues to take a look at their comments and consideration as well. But what I'd like to do, if you'll humor me, is I'd like to take a minute and share my policy views and then my values as it relates to the use of this site, because it has generated lots of local community discussion and interest. First, I support our shelter de-intensification efforts, including our appropriation of several $million to protect this vulnerable population and reduce the spread of the virus throughout the community. I also believe it doesn't make sense to change the location of de-intensification sites during the pandemic. Regardless of what I personally think about how and where sites were chosen, I think it would be a logistical challenge. It would be unreasonably disruptive to the clients and not consistent with public health guidelines to try to, rotate locations during the emergency. But I do believe that when the county is no longer operating under emergency authority, that all of our facilities should comply with city codes. Remember, none of these temporary emergency facilities had to comply with city zoning, permitting, public engagement processes. I believe the county should immediately put in place a plan for the future of the clients in our shelter de-intensification facilities, and that plan should be public and transparent. And very importantly, and this is a key, really key, I think, to resolving conflicts, I believe an essential part of that plan should be the criteria and metrics that our public health department will use to determine when it is safe to begin scaling back and concluding our emergency shelter de-intensification efforts. And I believe that those criteria and metrics should be adopted in a memorandum of understanding with the city of Renton as soon as possible. Echoing what some of the people who testified said today, I believe that our investment to provide hotel rooms to folks who were previously in traditional shelter has resulted in much better health outcomes and likely saves money to the overall system in the long run. And I believe we should learn from this model of care to try to build a better system of support for people with addiction disorders and mental illness as we come out of this pandemic. But as we try to build that better system, we also need to be honest about our limitations as a local government. As these temporary emergency federal funds dry up, and as county revenue, in particular our sales tax dependent mid-fund, gets decimated. And last but not least, I believe the impacts to the neighboring business owners, their customers, and city government are real and significant. And we have a responsibility to try to reduce those impacts and to mitigate the costs. Remember, the city of Renton is housing way more individuals in this facility than any other county facility deployed during the emergency, with more than 200 individuals moved from the Downtown Emergency Services Center shelter in Seattle's Pioneer Square into Renton. And as was noted in previous testimony, these are individuals with much higher levels of behavioral health needs, meaning mental illness or addiction disorders, than other locations we've deployed. And these sheer numbers, as well as the nature of the behavioral health needs, have presented challenges and impacts not being experienced in all the other sites, which is why I'm very thankful to my colleagues for supporting the mitigation fund I proposed in our last budget and I hope it can be used creatively to help the city of Renton assist impacted businesses. So those are my policy views. I want to finish by talking about values, and in particular, the value of respect. Respect for others should guide our decision-making moving forward. And first and foremost, this means respect for the clients in these facilities. And I was honored to be invited to tour the Red Lion facility and got to meet with Noah and his team, who you heard from earlier. And it reinforced what I already believed, that whether or not we have a home, whether we're sick or healthy, we're all part of one community. Respect for these clients also means working to secure more services in South King County for people who've lost their homes or who are sick. Next is respect for the impacted businesses. Nearby business owners and customers who are being impacted and incurring costs need to be heard and respected rather than dismissing them and making assumptions about their values. It is possible to prioritize and support vulnerable populations and still acknowledge that a high concentration of people with high behavioral health needs can cause and is causing some localized harmful impacts to others. And my job as a representative of the Renton community is to make sure everyone can express their needs and interests in a way that allows us to seek common ground and find solutions. Treating people with respect also means King County should treat our city partners with respect. Because of our current emergency, the decision by the county to operate a shelter in Renton at the Red Lion was made without having to comply with city zoning or permits and with no community engagement prior to the decision. And that's just the nature of emergency decisions. I get it. And I believe executive staff when they tell me that this facility is temporary during the pandemic. But I do remain frustrated with the lack of criteria and metrics our public health department will use to determine when it's safe to begin scaling back and concluding our emergency shelter de-intensification efforts. We heard some conversations in our public health briefing today about that overall body of work, and I would encourage them to expedite the body of that work relating to these facilities and the relationship with our cities. And I appreciate the county has offered to comply city codes once the public health department says that de-intensification is no longer necessary to prevent the spread of the virus. And that written assurance is enough for me to accept the report today. But simply saying when public health says so isn't really a plan, and it doesn't identify the criteria and metrics. And the slow pace of planning is creating an unnecessary uncertainty and a lack of transparency that I believe has led city government leaders to feel disrespected by the county. And I might be wrong, but I actually don't think the city and the county are far apart conceptually. And I'd like to offer to facilitate discussions between executive staff and the city if both parties think it would be helpful in finalizing the language of a memorandum of understanding. And finally, respect means showing respect for the owners of the hotel. I've really enjoyed the opportunity to meet with the owner, Mr. Pintu Bath, and his associate, Onkar Dhaliwal, on a couple occasions, once via Zoom and once in person. And they're great guys, and I've appreciated our positive and mutually respectful conversations. I shared no concerns with their decisions. I've made no requests of them. And so I was really sad to learn from them in a letter on Friday that others have apparently not treated them with the same respect. There's no doubt we're living in some difficult times, and with the loss of more than 1,000 lives in King County, to these tremendous economic hardships, to social isolation, people are frustrated and exhausted. Communication and problem solving is hampered. Existing inequalities have been exacerbated and laid bare. But as was noted, our responsibilities as county leaders are more serious than ever. And I actually have some hope in these hard times. I have hope because there is a strength and spirit that comes from the diversity in South King County. There's passionate and thoughtful leadership in the city of Renton. We have world-class public health professionals in King County, literally leading the nation in our response. So let's get the transition plan with metrics in place, get mitigation dollars flowing, and this pandemic will pass, and we can continue our work to provide for our most vulnerable and build safe and welcoming community in Renton and throughout King County. So thank you, colleagues, for indulging me in the opportunity to share my thoughts.
Thank you, Councilmember Upthegrove. Appreciate that. Are there other comments or questions? The action before us is just to approve the report, not to do anything long-term. And we've had a lot of input by email in testimony. I know that last week we heard that the Regional Homelessness Authority stood up, and we're well represented on that. So there's a lot of work that's going to go on into taking these learnings that we've had during this time, because it hasn't only been emergency response, we've also learned some things that may work better that will be helpful to our future work. So I look forward to that. But today's action is to approve the report. Is there anything else on that topic?
Madam Chair, I think it's to accept the report.
The agenda item says approve the report. Perhaps we can look at the...
It doesn't matter. That's okay.
Okay. I was just reading from the agenda. Perhaps I've got it wrong. All right.
I think we're approving a motion to accept a report.
For what it's worth, I believe it says to approve the report. I think that's what the agenda says in any event. So if we don't approve it, we should vote no. All right. I'm prepared to ask for the vote. Councilmember Zahla, did you want to say something?
Yes, please. I have a quick question for Leo, if that's okay, Madam Chair.
Please go ahead.
First of all, I just want to share my gratitude to Leo, everyone at the executive, the owner of the Red Lion, DESC, and all the housing advocates who've been fighting for this facility in Renton. The work that you've all have done is literally life-changing from what I've heard from people, clients who are there, as well as several other people who are related to this work. One question that I did have, Leo, you mentioned correctly that there are two sides to the equity equation. There are guests in the facility who are vulnerable, and there could also be neighboring communities, communities of color, low-income communities, seniors who are also vulnerable, and that's why we use an equity impact review tool. Leo, you noted that an equity tool was used and Renton scored as low risk. My question relates to the geographic scope and breadth of that tool. If someone told me that South Seattle scores low, I would wonder, do they mean Seward Park or Holly Park? They're both in South Seattle, but they are two very different communities, and I imagine they would have different equity scores. So was an equity tool used for that specific location in Renton, or is the score just for a broader geographic area?
Thank you, Council Member. The tool, and I will provide to all Council members a copy of the tool summary itself so that you're able to see it. The tool breaks into sub-regions. So Renton, for example, I believe it distinguishes between North and East Renton. And so, but I'll be happy to provide that. It does not do the equity analysis at the address level. It is also, so it's not that specific. It is not so broad as the city level, and it occupies a space between those where cities are large enough to justify that. The three specific regions in Renton are East, North, and South Renton that it treats differently.
Thank you. And are we not going to the address level given timing concerns, or is that usually not a practice? Why do we not go to the address level?
So this tool does try to get that right balance, Council Member, between a particular address, which in some cases we have certainly seen, a particular address might actually mask wider ranging effects. It's difficult, I think, to understand community effects at a particular person or facility address. We also, for the exact reason that I believe that animates your question, Council Member, recognize that you can get too broad. And so I believe that the rationale behind the tool is to try to hit at that right sort of community level, the area of impact that we would want to analyze. So we do not have the address specific, that tool does not work at the address specific level. We certainly take on from that tool additional address specific analyses. And so, for example, in examining this particular hotel and recognizing, exactly where it was, I don't think there's a place that you could put any type of facility in King County where it will have impact on no one. But this is a place at the intersection of of an interstate and then a state highway and a large parking lot where it is either physically separated from, it is not directly proximate to neighborhoods. It is directly proximate to some businesses. And we took all of that into account. We also did analysis of the shelter population itself and just looking to make sure that who we were serving, how do their demographics compare, for example, with the demographics of the city of Renton. So a lot of different layers of analysis that go into it that we lay in composite when we make the decision.
Thank you, Leo.
Dembowski.
Muted. I thought I saw Councilmember Dunn trying to get my attention before. Is that correct? While we're waiting, Councilmember Dembowski, please go ahead.
Oh, thank you. And Leo, thank you very much for the report and your work. Either you or Councilmember Upthegrove noted that, I think it was Councilmember Upthegrove, that this de-intensification site is the largest of them all at 200 people. I think he said more than 200. I wanted to understand the actual population that's there, and wondered if you could comment at all on the pluses and minuses of the size of the facility. I mean, I could see some efficiency in providing supportive services to a larger based population versus, the hotel voucher approach, and maybe those are different populations. But I also wonder if the 200 folks brought into that particular area, adds problems in terms of impacts at the Wajimaya and the neighboring office building. I do want to say that I personally went down and visited the site in the evening about a week ago. There was security there. There was fencing. It was quiet. Now maybe it's different than the day, and I have followed closely some of the stories about the neighbor impacts, and I've read the data provided by the building owner next door and listened to the city. But I'm kind of curious if you could talk a little bit about your view on the operations vis-a-vis size.
Thank you, Councilmember. Size is something that I think, are learning a lot of lessons about right now and have for some time. The facility itself is a 200 room facility. In some cases, there are 2 folks staying in a room, and so I believe that the shelter population at the Renton Red Lion has gotten as high as 225. It is in some ways a reflection of the 2 pre-existing congregate shelters that we de-intensified to the location. So there was the DESC main shelter on 3rd Avenue across from the courthouse, and then a lower Queen Anne DESC shelter as well. And overall, I think something that we are seeing over time is we really want to keep groups of people together as they form communities in sufficient numbers that they're able to support each other. And that from my perspective, the ideal size of a shelter can get too big. So efficiency turns out not to always have been our friend in shelter siting. In fact, I think it is the move towards efficiency that really led us to a system of maximizing density within congregate shelters, and that turned out to be the exact set of conditions that a virus needed to move really rapidly through a group of people. There's also, I think, an art to—
In fact, to interrupt you, I'm recalling our work up at Harborview Hall, where we had specific discussions about 100 kind of being the max you'd want to
go. Yes, Councilmember, and I do think that the number, there's some flex in that number. Providers will call it milieu management, but there's sort of an art to that, and a lot of it depends on building layout and population characteristics. But I do think you can get too big, and I do think that for clients who need a lot of support to succeed, that lower ratios, at least if not absolute numbers, are really important.
Thank you very much, Leo. And just so I understand the population, you mentioned the 2 shelters. The last time I toured the DESC shelter on 3rd Avenue, I recall being up maybe a floor or 2, but there was a very large room with stacked double bunk beds. So true, like big congregate housing with, a lot of folks would go in at night. Is that the space and the population that was deconcentrated down to the Renton Red Lion site and others?
It is, Councilmember. the main shelter for DESC plays a very particular role in our overall system. It's actually the shelter that will take folks from Valley Hospital in Renton, any of our regional hospitals often end up bringing their clients to DESC Main, and then it is very large rooms. It is extremely crowded. And DESC themselves, I think, have said and would say again that it is good enough to help people survive relative to being outside in the cold, but it is not the dignified kind of place that they would want people to be. Rates of disability our disabling conditions are high. I believe that it's about 70% of total shelter residents have a disabling condition. Demographically, it's about 33% persons who identify as Black or African American, which it overrepresents obviously against the population. 1.5% persons who identify as Alaska Native or American Indian, which is again overrepresented relative to the background rate in the community.
Right. Thanks for pointing out the hospital connection. I think that's one of the reasons Councilmember McDermott and I are strongly supportive of the 150 respite beds in the Harborview bond. That was presented as a very important need. One final question, if I might, Madam Chair, to Leo. Leo, given the hundreds of beds of increase in shelter capacity, even though we're coupling that with a deconcentration, could you articulate, and I know we're getting a little far from where I am from this written report, but could you articulate a little bit why we are seeing so many more tent encampments, unsheltered folks on the streets, or at least it sure seems like that to the regular viewer? What's the dynamic that's going on there?
Thank you, Councilmember. So some of this is conjecture, but one of the things that we're seeing is that the congregate shelters that still do exist in the system have lower capacities than they have traditionally, as they still seek to get additional space, safe space between residents. We also are seeing much lower rates of turnover inside of the shelter system. In fact, some providers are reporting turnover as low as 2 or 3% over the course of a week, where it is normally about 25%. And so we're seeing a lot of folks that are really getting into shelter and then staying in shelter, where those shelters are reducing their capacity in order to protect the health of the people who are inside of them. Another thing that I don't think that we have enough data to yet quantify in any particular way, but we are certainly looking for, is how many additional people might be beginning to experience homelessness. It stands to reason that in an economy that is reaching levels of unemployment that we have not seen in a century, that we will continue that we would see more people experiencing homelessness. I think there are a lot of good protections in place to reduce that impact, but we know that not all evictions occur, formally or legally, and that there are a lot of people in a very bad economic situation right now. And then the other thing that we are seeing is people are attempting to establish a place where they can do their best to establish social distancing or observe what they understand about public health guidance around hygiene. And so I think there are a lot of people who are sort of hunkering down, to use language that we've used, that everyone who has their own home gets to do. And we see a lot of folks who are trying to hunker down in small groups so that they themselves can also stay safe and stay healthy, but without the ability to do that in a home of their own.
Mm-mm.
Okay. Never.
Can you hear me?
Again now.
Okay, sorry, I'm having some technical difficulties here. My screen froze. Please go ahead.
Thank you. So first of all, I have some thanks. First of all, Dave, Councilmember Uppergrove, your thought process was very insightful and kind, and I appreciate you sharing it and your great representation of your district. And Leo, I just want to thank you for all the hard work you've done. It's very clear, even without your computer talking, that you clearly knew everything about what was going on, and the dedication that you've given to this. In talking with a number of people, they started talking to me about a word that I really like. It's called mutuality, where we begin to talk to our partners, who are the people living as residents, on what can we do together now that for many of them, they've made great progress. And in my conversation with the director of the ESC last week, he said that some of the people have improved so much that their own counselors hardly recognize them. So now that they are in a much better space, what are we doing to work with them for skill building so that they will have the skills that they may not have had the opportunity in the past to either avail themselves of or to really be able to take in?
Thank you, Councilmember Lambert. Two ways to answer the question. One is we do have the good fortune in DESC of an operator that sort of operates over the full panoply of services. And so they are a Medicaid-funded behavioral health services provider. In addition to being a homelessness shelter provider, they provide permanent supportive housing. And so they have skilled case managers who I think do really wonderful work. Exactly what you're talking about is how do we secure gains that a person might make and then help set the conditions for them to be successful going forward. And I think that we can do more. I think what I hear in your question, what we're certainly looking for ways to do is how do we now, once we've stabilized someone in a home and we have solved the problems of exhaustion, lack of hygiene, a lack of access to food that I think were the types of, lower layer on Maslow's hierarchy, we're up a little bit higher now by virtue of having provided what is essentially a home to people. And so the adjustment that we now have to make is how do we bring in economic assistance, employment assistance, additional persistent behavioral health assistance, and then also really continue to help the residents of the shelter itself continue to cohere, continue to support each other. I think some of the most effective and some of the most heartening data that I've seen is just the ability of the shelter residents to really relate to each other, to support each other, and then to now, form those mutual, as you were saying, Councilmember, establish mutuality with the staff there. And what we're seeing is when people have their basic needs met, they can then turn to some of the higher order needs that many of us still take for granted, but now are suddenly available. And so we have small stories of people getting jobs, and you heard about one of those today. Other residents have started jogging, which I can't even seem to get myself to do. And so I think we have a lot that provider can do. DESC, they're skillful, and it is now DCHS's job to figure out what other unmet needs there are, and then to bring services in so that we can capitalize on the initial success of the project.
So two things, if I might continue, Madam Chair, is that all right? One of the things that we talked about, the director and I last week, was that there is some space inside the facility that could use some reshaping. And this seems to me like a good time while the building is empty. Look at some configuration changes that might be helpful. And then how you will figure out how many people come back to that facility. And just so you know, one of the things that I talked to him about was that I do believe that every single person needs to have an individualized plan like you have in a school, an IEP, where we all know what the expectations are for people to get strong and healthy and to be able to chart that. So it's always helpful for people, like if you're on a diet, keep a chart of how you're doing. And when you've lost 30 pounds, to be able to look back at the chart and say, hey, I did it. And I think for a lot of these people, having a chart will help them to get on the course. So I'm excited about that. Thank you.
Okay, thank you. We have a motion before us. It is to approve this report. And I am going to jump way out on a limb and ask for the clerk to go ahead and call the roll.
Thank you, Madam Chair. Councilmember Dembowski.
Aye.
Councilmember Dembowski votes aye. Councilmember Dunn.
Aye.
Councilmember Dunn votes aye. Councilmember Colwells.
Aye.
Councilmember Colwells votes aye. Councilmember Lambert. Councilmember Lambert.
Aye.
Councilmember Lambert votes aye. Councilmember McDermott.
Aye.
Councilmember McDermott votes aye. Councilmember Upthegrove.
Aye.
Councilmember Upthegrove votes aye. Councilmember Von Wright Bauer.
Aye.
Councilmember Von Wright Bauer votes aye. Councilmember Zahalai.
Aye.
Councilmember Zahalai votes aye. Madam Chair.
Aye.
Madam Chair, the vote is 9 ayes, 0 noes.
By our vote, we've adopted proposed motion 2020-0190. If there's no objection, the published marked agenda together with any changes made in today's meeting will stand approved as the first reading and referral of ordinances items 16 and 17. And there was the one other, which we did earlier. That concludes the items on our agenda. Before we adjourn, I want to do two quick things, council members. First is I want to make sure that technical difficulties didn't stop any council members from voting. I kept a rough tally, and I think I heard everybody vote on every item. Was that your sense too, Madam Clerk?
You are correct. I've recorded all votes today.
Okay, very good. Secondly, after this meeting adjourns, we are going to immediately have an Employment and Administration Committee meeting, and I'm going to ask your indulgence to start that meeting now, do 5 minutes worth of stuff, and then take a break while we shift over to a Skype executive session. And we can have like 5 or 10 minutes in between there so that people can have their break and get up from their chairs. And unless I hear any strenuously loud objections, I'm just going to go ahead and do that. So please stay on the Zoom call for a
Madam
moment.
Chair, they're going to need a minute just to flip over their graphics. CTV will.
Okay.
I know. Otherwise, it will still look like this.
You mean actual minute, or is that a maybe?
I'm going to say an actual minute. They will be texting me momentarily.
Okay. All right. So I'm going to adjourn this meeting and ask everyone to stay on the line just for a moment, and we'll move into EAC as soon as KCTV is ready. Do just a few quick things, and then we'll take a recess. So please stay on the line. This meeting is adjourned.